Hey everyone, it's Amia Khan here with your afternoon edition of FOX10 News Now. Happy Thursday. I usually am happy on Thursday because I know it's Friday tomorrow and then that starts the weekend, so I hope you guys are having a good Thursday too. Plus it's Throwback Thursday, which always warrants a fun old photo of yourself on Instagram. So those are the two benefits of Thursday. I hope you guys had a nice lunch break for anyone who is local, and wherever you are in the world, I hope you're enjoying your day. As far as news is concerned, we have a lot of news ahead. A lot of events were sent to us all day today, and one of the things I really wanted to talk about was the fact that our governor, our Arizona governor, Doug Ducey, is actually getting to meet the Pope next week. That's so cool. That's very cool. As you guys know, the Pope is going to be in the United States next week, and our governor is going to be there. He spoke with Andrew Hasman about the upcoming trip, so we're going to play that clip in just a few minutes. Plus, you guys know the three people who are being honored. They're being hailed heroes for thwarting that terror attack on that train in France. Well, they were honored today. They went to the White House. They met President Obama. It's a pretty big deal. They had a special event for them featuring Ashton Carter. So all of that's going on. Plus, if you have any health concerns, there was a press conference about this upcoming flu season, what you can do to keep yourself safe, and all the new vaccines out there and the prevention tips. And that was put on by the Centers for Disease Control and Prevention. I have that ahead. And of course, if there's breaking news, I'll take you there as well. So lots ahead. I know we dedicated our entire morning to politics and last night's GOP debate. So I personally am not planning to talk about the debate anymore during my portion of News Now. Maybe Mike will talk to you about it later. Maybe Kinsey will talk to you about it later. But if you missed the morning edition of News Now, I encourage you to go back and watch the first couple hours, because really Ron and I and Steve Kraft as well just dedicated it all to a recap of last night's GOP debate. So I highly recommend it. It's great TV. I mean, great internet TV. So with all of that said, I'm going to play a few stories for you while I wait for this Pope sound to get in the system. Let me see what I can play for you right now. Well, I know it's a sad story, but you guys need an update on it. You know that tragic story out of Utah, well, the border of Arizona and Utah. The couple families that got swept up in the floods. Many people dead, one child still missing, a 6-year-old boy. Only 3 people survived. Very, very sad story. A total of 13 dead. One still needs to be recovered. This is the update, the latest story we have out of Fox National on this story. So I'm going to play this for you now.
They're vibrant personalities. They were fantastic with their children, and they were a pay attention to detail kind of people.
Monday, a flash flood swept 2 vehicles carrying 16 members of Rose Marilyn Barlow's extended family down a raging creek. Rose's brother Joseph is the husband of Josephine Jessup, Naomi Jessup, and Della Black, and the father of all their children.
These were beautiful people, very beautiful people, not only in the outside, but the inside. I don't think that those dear sweet mothers would want to be separated from those dear children. This is the way if they had to go, they would rather go with their children.
Rose and her husband Peter had not been in close contact with them for the last few years, the result of religious differences which have divided many families in Hilldale and Colorado City.
The alienation has been so intense that it's almost like we don't know our very own families anymore.
But if there is a silver lining to this tragedy,
I feel like it has brought the community together, and the different factions have worked together for this common cause.
That water was rising at a very rapid rate.
John Barlow witnessed the flash flood hit last night, picking up these 2 cars and dropping them in a wash. At least 13 people are believed to be dead.
To, go out for a ride and never come home is pretty sad.
Searchers moved along the banks of Short Creek, searching for the victims.
Wow. So the water caught him from behind and then the side, and just...
Lieutenant Governor Spencer Cox toured the devastation today, offering condolences and pledging state support to help rebuild.
it is unbelievable and something you just never expect to see or have to deal with. And the community's just really in shock right now, as I think we all are.
For the secluded polygamous community of Hilldale, the flooding left people stunned.
We realize that, this is an act of God, and this is something that we can't control. We have to take what we receive and do the best we can.
Flash flooding in Utah has now killed at least 18 people as crews continue to search for those still missing. The Utah National Guard, along with federal search teams, are trying to find a 6-year-old boy who hasn't been seen since 2 vehicles were swept away in raging waters on the Utah-Arizona border.
We're going back through with the dog teams and the Utah Task Force 1 and recovering the areas that are immediately through the portion of town that is separated by the different culverts.
Even though the water has receded, crews say the area is still very dangerous.
There's, 15-foot dirt sand walls that are just constantly caving in, so they're being very careful to stay back from the edges of those sand walls.
Also in Utah, crews have found the body of a 6th hiker who was killed when fast-moving waters swept through a narrow canyon at Zion National Park. Another hiker is still missing. Park rangers say the group was told about the danger of flooding before entering the canyon, but there was no way to warn them once the waters began to rise.
We work so hard at the beginning of our contact with them to truly talk to them about the weather risk.
Meantime, the father of one of those killed in the flooding is thanking the community for their support.
We express our sincere gratitude for the kindness and assistance at this inexpressible time of sorrow.
Among those helping with the search and rescue effort in the Utah area is a team that once combed through the wreckage of the World Trade Center after 9/11. In Los Angeles, Adam Housley, Fox News.
All right, so I played 3 different clips just giving you an overview of what was going on as a result of those floods in Utah. Still just a really sad story. Want to acknowledge what Dee said in case you didn't hear it. In that story, also 8 people in Zion National Park, 7 found dead, 1 missing. Yep, those were hikers. Dee, I did see that headline early this morning. Very, very sad indeed. And Tess saying, wow, those cars are smashed up. I know, when we first covered it the first time around, oh my gosh, the cell phone video is crazy. You guys want to see that cell phone video again? It's of the actual car falling. Oh my gosh, I just paid attention to that and really noticed it. Hold on a second. Let me cue it up for you. It's kind of disturbing. I did not... Or maybe I'm just envisioning things and it was never there. Oh, here it is. Oh my God. Oh my God. That is the saddest. It's just one small clip, but I think that is the most tragic thing that I've shown on News Now, or one of them. Oh my gosh, I feel so disturbed. I can't believe I showed that all to you again. That's sad. I'm sad now. I shouldn't have started with the death hour, but I did. Sorry. Let me see what other stories I can share with you guys just to lighten things up. How about this? This is a happier story. I'm hoping it's a happier story. Based on the title, it should be a happier story. The name of the story, it's out of Florida, Homeless Helping Homeless. Fingers crossed that this isn't a sad story either.
Go, and now we got to go out.
1 step forward, 2 steps back for men like Fernando Lopez being forced out of a second Homeless Helping Homeless house in Tampa.
It's very difficult when we ain't got a place to say this is our home, or make a home, or try to fix a place to make it a home. All we need is a break. All we need is a chance.
A chance, he says, the city of Tampa isn't granting. Code enforcement officers stopped by the facility on East Oak Avenue last Thursday, finding several violations and giving dozens of homeless men staying there an order to vacate. Just 1 week after shutting down their other home on East Florabraska Avenue for things like rotting floors and walls and electrical issues.
Something got to give. between liability insurance, you know what I mean? I mean, certain things just have to give. You just can't do it all.
Adolphus Parker, the founder of the homeless charity, says he feels the city is retaliating against him for filing lawsuits on its panhandling ban downtown, a policy deemed unconstitutional by city council, but Parker's lawsuit is ongoing.
Knowing that I have nowhere to put them, you know what I mean, is very unsettling.
Shutting down the house has only made organizers more resourceful. Tonight, they'll be sleeping in these tents in the backyard.
We won't have the actual solid roof over your head. You know, you're going to have to worry about the mosquitoes biting you at night.
Not exactly luxurious, they say, but still better than the streets.
They're either going to sleep here or they're going to sleep on some other property, you know, or under the bridge. And this is not a violation. You know what I mean? You can't have fire out here on the tent.
All right, guys, I apparently was fooled by the title. That story is also really sad. So let's just move away from the story sent to us by Fox News for a moment and focus on things locally, okay? I'm going to play for you the clip now. This is an interview that Andrew did with Governor Ducey this morning. As I mentioned at the top of the show, Governor Ducey is set to meet the Pope next week in Washington, D.C. Very cool. So Andrew spoke with him about that, as well as his reaction to last night's debate. Dang it, I am talking about the debate. I even said I wasn't going to, but here I am. I guess it's a topic that I can't get away from. It's still the talk of the town. And I guess it's time to hear what Governor Ducey had to say. Cue this up. All right, guys, enjoy.
How do you think that went? You were in Simi Valley watching all the candidates try to...
I thought it was long. I think there's a lot of people on stage, a lot of good people on stage. I'd like to see possibly shorter debates and deeper policy discussions, but I think there's terrific candidates. I'm undecided, but I think there was a lot of quality there.
Who do you think came out on top of the debate?
I think Carly was certainly a great added addition, but I don't think anybody up there hurt themselves. I just think everyone's trying to figure out who's who, and somebody said to me that there will be 2 World Series played before we decide our next president. That's why I'd like to see more discussion and deeper policy debate.
You're a big Scott Walker fan. You know, a lot of people tout you as a Scott Walker of the West, or at least your folks have said that. How do you think he did?
Well, I would take that as a compliment. I mean, what Governor Walker did in Wisconsin is remarkable, and I think he did well. They're judging a lot of these folks on the amount of time that they spoke. Whenever somebody gives time back to the moderator, I sometimes think more highly of them. I think sometimes there's too much talk and too little action, but everybody up there's got a record of action. So this is part of the process, and this is also why I'd like to see more of it. There's so many people on that stage, and even on the pre-debate stage, that are really quality folks that have credentials. But I don't think anybody hurt themselves. I thought that it was a good night for many, and then there's the entertainment factor, and you've got to put that in there. And I'm curious to see if the polls move at all. I think they might stay close to the same.
3 people who seem to be getting a lot of attention, all political outsiders. You were once a political outsider.
Yes.
What do you think that means, and what do you think it says about the electorate right now and how they feel about politicians?
Well, I felt it during my election. I mean, to stand up and to be able to say I have no political resume to tell you about, I'm from the private sector. It's too bad, but it's been well earned by politicians. But I really think it's a result of what's going on in Washington, D.C. If you look what's happening at the state level in so many different places, good reform-minded governors can get things done. We were able to do that in our first term. I'm going to stay focused on that, stay focused on my day job. But I think the person that can make that case, whether they're an outsider and a business person or somebody who's an existing office, it's about building that trust. And there's been a lot of trust that's been eroded in our federal government. And I totally get that. And I think the anger is being channeled through that.
Let's talk about trust in state government, Governor. It's Constitution Day today. It's kind of ironic that there's 31 kids in that class you just read to. A lot of the reason there's 31 instead of 26 is because the legislature failed to follow the state constitution and fund inflation. You have this trust land proposal up. What do you think What do you think of the other proposals that are floating out there, a supplemental appropriation, a special session?
Well, first I want to say that it's great to be out here at the Dysart School District at Sunset Hills, and this is a school that's getting it done and getting it done right. When you have principals like this, when you can get more money to them, they know where it can best be applied. The kids in these classrooms are getting a terrific education. We want to see more of this going on across the state. So our idea on the state land trust proposal is to put $2.2 billion additional new money into our K-12 system over the next 10 years. We're working on a strategy to get it done more quickly. I'm going to have to work with the House and the Senate on that, so we're laying that groundwork now, and there will be more to follow.
But the kids at this district are suffering. I talked to the superintendent. She goes, we aim for 25, 26 kids in these lower-level classes. There's 31 in that class, and they can't get the individualized attention they need. Don't you think you need to get them money now rather than a year and a half from now?
We are going to get the money to them as quickly as we can, and we believe we can do it before a year and a half from now. You can't just say, hey, I'm going to do it now and have it here tomorrow. We're laying the groundwork for that process, and like I said, that's on us and next steps to follow.
And under your Classrooms First initiative, this school got about $3.9 million extra, but then you took away $3.9 million in other funding. So they ended up with $100,000 more for this district total out of your budget.
The state had a $1 billion deficit last year. We were able to close that deficit while protecting K-12 education. We were actually able to put in slightly more in K-12 than we did the year before. This funding proposal will take care of that, and that's why we're working so hard on it.
Okay.
Governor, before you go, just a couple questions about the Pope's visit. How did this come to be, and how excited are you?
Well, we're very excited, and it's not every day that you receive a call from the White House inviting you to come to Washington to greet the Pope. So I'm really honored to be able to do it. I'm humbled, and as a cradle Catholic, I'm excited, and so is my wife, Angela.
So you're going to be there at the White House. Are you going to get the chance to actually meet the Pope?
Well, that's yet to be decided. We'll be there, and I hope to be able to greet him, but, you know, I don't know how they're going to handle his schedule or his calendar.
Have you thought about what you'd say, ask, or
well, first,
you get the chance to meet him?
Well, first, if he had anything to say to me, I would be there to listen. But if we were able to have a conversation, I certainly would ask for prayers for Arizona and for our families and children here.
This has got to rank as one of the top experiences in a life, I would imagine.
Absolutely, absolutely. It was incredible when my assistant came in and told me about it, and it was an easy yes. Thankfully, we were able to work the calendar to make it happen.
Thanks.
Thank you.
Appreciate it.
Thanks.
You gotta leave?
Anything else?
That probably covers it. I mean, it does strike.
All right, guys, so that was Governor Ducey speaking both about the GOP debate last night. He was there in person, and next week he's going to D.C. to meet the Pope. I would say being governor of Arizona sounds pretty fun because he got to be at the debate last week and meeting the Pope next week. Those are the big stories around here, so Governor Ducey has it made. I'll leave it at that. And I do want to say that I know I was looking for a happy story to play for you since I kicked off the show on a depressing note, so I know what I'm going to share with you. I'm going to play for you the video from this morning. You know the train attack in France that was thwarted, the heroes that have been, you know, they've been all over the news. Well, those same 3 heroes went to the White House today. They sat in the Oval Office with President Obama, and I have that clip right here, so I'm going to play that for you. And I can be 100% certain that this is a happy story. So that's good, right? Just find it, if I can find it. I will find it, guys. There's a lot of files. There's got to be an easier way to do all of this. There we go. All right, guys, enjoy.
2 of whom had served in uniform on behalf of the United States Armed Forces, thinking that they were just going to have a fun reunion up in Paris, and ended up engaging a potential catastrophic situation and pinning down someone who clearly was intent on doing a lot of harm to a lot of people and inflicting terror on French people. Because of their courage, because of their quick thinking, because of their teamwork. It's fair to say that a lot of people were saved, and a real calamity was averted. And the French people have already bestowed on them the highest honor that they can, the Legion of Honor, at a ceremony presided over by President Hollande of France. I had an opportunity to talk to him, and he told me that he could not have been more grateful for what these three outstanding young Americans did. And I just wanted to make sure that, having talked to them on the phone right after the event, that I had a chance to shake their hands in person and to tell them what I think they've heard from a lot of people, which is they represent the very best of America, American character, and it's these kinds of young people who make me extraordinarily optimistic and hopeful about our future. And I want to thank each and every one of them and wish them well. I'm glad to see that Spencer, apparently his hand is in pretty good shape and making real progress, and he intends to continue to pursue his work in medicine and caring for people. Anthony is interested in sports medicine and therapy, and Alexander, as soon as he's finished on Dancing with the Stars, plans to get into law enforcement. Whatever they do, they're going to do it well. And we just want to say thank you to them for not only saving so many lives, but also for making America look so good. All right? Thank you. Come on, let's get one. We'll get one good picture. Squeeze in here, guys. All right. You all right? You're looking good, man. You're looking clean. Fantastic. Thank you, man. All right, we'll follow up. We'll make a point to follow up. Thank you. Someone who clearly was intent on doing a lot of harm to a lot of people and inflicting terror on the French people. Because of their courage, because of their...
All right, guys, so that was the gist of their meeting. It was fairly brief. However, there was an entire event honoring these three men as well in D.C. Ashton Carter, our Secretary of Defense, spoke at that event, as well as a few other people. So let me go ahead and pull up this event honoring the three American heroes who thwarted that train attack in France. Where? I wish I could find these clips quicker. There's just too much on the screen. Oh, here it is. Enjoy.
Good afternoon, ladies and gentlemen. Albert Einstein once said that this world is a very dangerous place, not because of the people who wish to do evil, but because there are so few of us that try to make a difference and do anything about it. Mr. Secretary, Senator Feinstein, representatives from the states of California and Oregon, distinguished visitors, members of our honorees family, it is a privilege to share this stage with three young men who did something about evil. Today we're here to honor Specialist Alex Garlatos, Airman First Class Spencer Stone, and Mr. Anthony Sadler for what they did in their heroic action that day on a train bound for Paris. We're here to honor their bravery and their willingness to act. It's awful difficult for us to imagine what might have happened on that train that day had they not taken action. And for that heroism, we are here to present the Soldier's Medal and the Airman's Medal, the service's highest award for members who have distinguished themselves in non-combat heroic action, which involved risking their own lives. as well as the Medal of Valor, a medal that was brought into being after September 11th, 2001 for civilians who took the same risk. I stand before you today as a person who owes his life to an airman. That airman risked his life to save mine, not unlike these 3 young men did that day on that train. And I have lived my life and led my career with the abiding belief that when each of us who wear this uniform or choose to defend this nation are called, we will do the right thing. Gentlemen, thank you for acting. Thank you for being people that cared enough to make a difference. Ladies and gentlemen, it's my privilege to introduce to you our Secretary of Defense, Ashton Carter.
Good afternoon. General Salva, thank you. Little less than a month ago, 3 childhood friends were on a train bound for Paris when they heard a gunshot. Amid screams and commotion of the passengers, they quickly focused on a man wielding an AK-47. Almost instantly, one of them said, "Let's go," and the 3 ran toward the shooter. Those 3 friends are with us here today. Thank you, Alec, Spencer, and Anthony, for what you did on that train and for joining us here. Distinguished guests, Senator Feinstein, Senator Wyden, Senator Merkley, Congressman Barra, colleagues here, past and present, members of the Defense Department and community, it's a pleasure to come together to welcome and recognize Alec, Spencer, and Anthony, welcome them home, to celebrate the heroic action they took at great risk to themselves, and to reward them our highest commendations. We also want to recognize some of their friends and families here today. To all of you, thank you. You raised some great kids. Yeah. Well done. Not bad, huh? Alec is a National Guardsman. After returning home from a deployment to Afghanistan, he recently chose to enlist. Spencer is a medic based at Logis Air Base in Portugal, and next month he's headed to Travis Air Base, California. And Anthony is starting his year at Sacramento State University, where I'm sure he'll have the best "what I did on summer vacation" story of anybody. And that's because after Alex said, "Let's go," he and Spencer and Anthony sprinted toward the gunman while he trained his rifle on them. Spencer tackled the assailant, and the 3 worked to disarm him. As we know, Spencer was stabbed in that effort. After they knocked out the gunman, they tended to other injured on board before paramedics and police arrived. It's an amazing story, right out of a movie. And Alec, Spencer, and Anthony have been rightly celebrated on both sides of the Atlantic. But I want to focus on the moment when they heard the gunshot and when they took off toward it. Think about that moment. When some took cover and ran, when others were unsure what to do, these 3 friends said, "Let's go." And if that sounds familiar, it's because it is. Last week, for example, we gathered here as a community to mark the anniversary of the September 11th attacks. On that day, on United Flight 93, a group of passengers with the words, "Let's roll," stood up and fought back against the terrorists who had aimed the plane toward Washington. And while these heroes were lost, we will always remember and appreciate their courage and sacrifice. "Let's go" should also ring true to many in this building because it speaks to our mission here. Each member of the Defense Department, in uniform and civilian, has chosen to dedicate themselves to standing between order and disorder, between the way of life we cherish and those who would threaten it. And that's one reason that America has the finest fighting force the world has ever known. Like Alec and Spencer, each man and woman who serves in our defense enterprise has looked at that world and at those risks and said, let's go. It's a perfect example of the force that we have now and the force of the future. Active duty, guard, and civilian team together to produce a powerful force, acting agilely in concert, each one important. And it's also familiar because the words "let's go" are as American as these three friends are. Time and again, challenge after challenge, the sound of gunshots and danger, the world has turned to the United States, to its military, for help. And generation after generation, we've answered with a simple "let's go," and the resolve necessary to beat back dangers and stand up for the values so many around the world hold dear. Ours is a world full of opportunities and challenges. Thanks to young guardsmen and airmen like Alec and Spencer, and many other soldiers, sailors, airmen, and Marines like them, and young citizens like Anthony, I'm confident that we will continue to grasp hold of the bright opportunities and meet the evil challenges, echoing these same simple, stirring words of theirs, let's go. From the Pentagon to you three guys, well done.
Specialist Alex Scarlatos and General Silva, please join Secretary Carter in front of the flags. Mr. Fanning, General Grass, and Sergeant Major Brush, please join for the award presentation on stage. Attention to orders. The President of the United States of America, authorized by Act of Congress 2 July 1926, has awarded the Soldier's Medal to Specialist Alexander Scarlatos for heroism above and beyond the call of duty on 21 August 2015. Specialist Scarlatos distinguished himself in a courageous manner, voluntarily accepting risk to his own life on board a high-speed train carrying hundreds of passengers in the proximity of the French and Belgian borders. Specialist Scarlatos' brave actions prevented a potentially catastrophic loss of life. Specialist Scarlatos, unarmed, led the effort to confront a gun-wielding assailant. He physically disarmed, subdued, and restrained the attacker. This selfless act of courage prevented potential massive casualties. Thanks to Specialist Scarlatos' heroic efforts, minimal injuries were sustained by passengers. His actions are in keeping with the finest traditions of the 186th Infantry Regiment and the United States Army. We are honored to have congressional delegation from California and Oregon join us for this special presentation. Senator Feinstein, Senator Wyden, Senator Merkley, Dr. Berra, please join Specialist Scarlatos on stage for a photo. Thank you, Specialist Scarlatos, elected officials, and service leadership. Airman First Class Stone, please join Secretary Carter and General Silva in front of the flags. Secretary James, General Welsh, Chief Master Sergeant Cody, please join for the award presentation on stage. Attention to orders. The award of the Airman's Medal to Spencer J. Stone. Airman First Class Spencer J. Stone distinguished himself by heroism involving voluntary risk of life while traveling on a high-speed train in Belgium, en route from Amsterdam, Netherlands to Paris on 21 August 2015. On that date, Airman Stone immediately responded after seeing a heavily armed gunman enter his train car prepared to fire an AK-47 assault rifle. Without regard for his personal safety and without hesitation, he sprinted unarmed towards the gunman and brought him to the ground. The gunman was armed with the assault rifle, an automatic pistol, 270 rounds of ammunition, a box cutter, and a bottle of gasoline. An intense physical altercation ensued, and despite receiving multiple lacerations on his face, neck, and thumb, Airman Stone, with the help of other passengers, was able to disarm the gunman. After choking the gunman to the point of unconsciousness, Airman Stone ensured he was restrained and unable to move. Next, completely ignoring his own injuries, Airman Stone exhibited extraordinary poise while rendering critical life-saving medical care to stop the bleeding caused by a gunshot wound to the neck suffered by another passenger. Airman Stone's decisive actions prevented the gunman from opening fire on unarmed civilians, potentially saving the lives of hundreds of passengers on board, and definitely saving the life of a wounded passenger. The exemplary courage and heroism displayed by Airman Stone reflect great credit upon himself and the United States Air Force. Attention to orders. The Purple Heart is awarded to Airman First Class Spencer J. Stone. Airman First Class Stone was wounded in an attack while on board a French-operated Amsterdam to Paris high-speed train in the vicinity of the border between Belgium and France on 21 August 2015. Airman Stone joined the effort to confront and subdue a foreign national motivated by radical religious influence who intended to cause mass harm to the occupants of the train. As a long-standing priority target for multiple terrorist organizations, France has suffered several attacks during 2015. In my judgment, For the purposes of this award, these circumstances meet the executive order criteria for an international terrorist attack against a foreign nation friendly to the United States. We are honored to have congressional delegation from California join us for this special presentation. Senator Feinstein and Dr. Barra, please join Airman Stone on stage for a photo. Thank you, Airman Stone, elected officials, and service leadership. Mr. Anthony Sadler, please join Secretary Carter and General Silva in front of the flags. Deputy Secretary Work, please join for the award presentation on the stage. Attention to orders. The award of the Office of Secretary of Defense Medal for Valor to Anthony Sadler. On August 21, 2015, Mr. Anthony Sadler boarded a train in Amsterdam, Netherlands, carrying hundreds of passengers destined for Paris, France. 2 hours into the trip, just after crossing the border into France, witnesses reported an individual entering a lavatory along with his luggage. The individual emerged from the lavatory sometime later, brandishing an AK-47 assault rifle. After hearing a struggle, and while unarmed, Mr. Sadler charged at the gunman, alongside 2 U.S. service members. He disarmed and subdued the gunman. After assisting in the tying up of the gunman, Mr. Sadler reassured that passengers that they were no longer in danger. Reports from witnesses and investigative agencies after the incident indicated that the gunman was heavily armed with approximately 270 rounds of ammunition and was on a European watch list of questionable individuals. Mr. Sadler distinguished himself in a heroic manner by voluntarily accepting risk to his own life, preventing potential catastrophic loss of life, and protecting the lives of 2 U.S. service members. We are honored to have the congressional delegation from California join us for this special presentation. Senator Feinstein and Dr. Barra, please join Mr. Sadler on stage for a photo. Thank you, Mr. Sadler, elected officials, and Department of Defense leadership. Ladies and gentlemen, please join me in giving another round of applause to these three Americans. Please remain standing for the playing of the Armed Forces Service Medley by the U.S. Army Band Brass Quintet.
We always ready for the call. We place our trust in Thee. Through surf and storm and howling gale, I shall our purpose be. Semper Paratus is our God, our fame, our glory too. To fight, to save, or fight and die, I Coast Guard we are for you. Off we go into the wild blue yonder, climbing high into the sun. Here they come, zooming to meet our thunder. Atom boys, give her the gun, give her the gun. Down we dive, spouting our flame from under. Up with one hell of a run. We live in flame, we'll go down in flame. Ain't nothing can stop the USA flag. Anchors away, my boy, anchors away. Farewell to foreign shores, we sail at break of day. Through the last night on shore, drink deep of them. Until we meet once more, here's wishing you a happy voyage home. From the halls of Montezuma to the shores of Tripoli, we fight our country's battle. Proud of all we have done, fighting till the battle's won, and the army goes rolling along. Then it's high, high, hey, the army's on its way. Count off the cadence out and strong. For wherever we go, you will always know that the army goes rolling along.
Ladies and gentlemen, please remain standing for the departure of the official party. Thank you for joining us. This concludes today's award ceremony.
All right, guys, that is a wrap on that event honoring those train attack heroes. As I mentioned at the top of the show, I have a couple more events that I'm going to share with you. One of them is a press conference or an event held by the Centers for Disease Control and Prevention about this upcoming flu season, how to take care of yourself, precautions, things like that. And then at 3 o'clock, we'll be getting a live press conference featuring Sheriff Joe Arpaio. The specific details are that Sheriff Joe Arpaio holding a press conference today outside 4th Avenue Jail to discuss a county-wide drug operation being launched by his deputies and volunteer posse. So stay tuned for that, because we'll be seeing Sheriff Joe live in just a little bit. But in the meantime, let's go ahead and watch this press conference about the upcoming flu season, courtesy of the National Foundation for Infectious Diseases and the Centers for Disease Control and Prevention.
I will say that for healthcare workers, it's particularly important to get vaccinated yourself and also to ensure that all of your patients above the age of 6 months are vaccinated. As Bill Schaffner noted, we're also emphasizing pneumococcal vaccination. There are 2 types of pneumococcal vaccination. We recommend the pneumococcal vaccination for everyone over the age of 65 and for some people under the age of 65 who have chronic health conditions such as diabetes or chronic lung disease. So when you get your flu vaccination, be sure to make sure that you're up to date on other vaccines. We have a call to action with 3 steps. First, get vaccinated. That's the best way to protect yourself, your family, and your community against flu. Second, take everyday preventive actions. Cover your cough and sneeze, and if you're sick, stay home. And third, if your doctor prescribes antiviral medications, take them. They're a second line of defense. The analysis that CDC scientists have done suggests that these medications, particularly if given promptly, can reduce the duration of illness by about a day and can reduce the severity of illness. The bottom line, flu is unpredictable, but you can predict that the single best thing you can do to protect yourself is to get a flu vaccine. Make getting a flu vaccine a norm for yourself and your family this year and every year, just as I do. Thank you very much.
Thank you, Tom. Thank you, Tom. Kathy, Dr. Newsel.
So,
would you like to stand up here?
Oh, sure. So thanks, Bill, and thanks, Tom. And I am passionate about influenza, as you heard from Bill. I've studied influenza vaccines for most of my career. I'm also a practicing physician, and unfortunately, I've seen too many patients with influenza. We heard from Dr. Frieden the figures on influenza. I've seen people who have died from influenza, and while most deaths do occur in older persons in the U.S., young, healthy people die from influenza every year. Children die from influenza every year, and we'll hear a little bit more about that from Dr. Swanson. People get sick with flu, and people also just feel bad. If you talk to people with influenza, it's not a cold, it's not a sniffle. They'll say, I feel as though I've been hit by a truck. That's one quote I've heard from a patient. Or I feel like I've been beaten up. So flu also makes us miss work, makes our children miss school, and makes us feel bad in general. So the news is that more people are getting vaccinated, but far too few are getting vaccinated. And as Dr. Frieden said, we need to try to improve that. So where can a lot of the gains be made? And a lot of the gains can be made in the young and middle-aged adult population. So let me tell you another story about a medical story when I was asked to see an older patient who had been in the chronic care portion of our facility, had been there for about 6 months. We were called to see him, and we diagnosed him with a pretty severe influenza pneumonia. Then we started to ask the question, well, he's been in this facility for 6 months, and pneumonia circulates every year between about November and March, and of course it changes. Many years it doesn't circulate till January. How did he get the flu? He's not out there going to the store, and the only way he could have got influenza is because somebody brought it to him. That could have been a healthcare worker. It could have been a family member or a friend visiting him. And so for young and middle-aged healthy adults, protecting others should be as compelling a reason to get the influenza vaccine as protecting yourselves. And if everybody thinks about it, there would be very few people in this room who don't mix every day with young children, with older people with cancer, people with serious lung disease. We are walking around, we are the transmitters in the community. And so it's quite important that we get influenza vaccine for that reason. So I think the public health and the medical and the research communities have been listening. So why don't people get influenza vaccine, and what can we do? Well, first there's we didn't know we needed it, which is one reason that we're here today. You do need it. We strongly recommend influenza vaccine for everyone 6 months and older. The second reason is, I'm kind of invincible, right? I'm young and healthy, I run every day, I eat right. You can still get flu, and importantly, you can certainly transmit that flu to people who aren't as young and healthy as you are and are much more vulnerable to the complications. None of us have time, right? We're all busy, we're all rushing around. I don't have time to get the flu vaccine. So we've really tried to listen there too. And vaccine is now available in the workplace. It's available at pharmacies. It's available earlier than it used to be, and it's available later than it used to be. So we really need to make it a priority. And the number of flu vaccines and choices we have is much greater as well. So if I don't like needles, I can get the nasal spray. I can get the intradermal vaccine, which is a tiny, tiny needle. If I have a patient with a really severe egg allergy, we now have an influenza vaccine that's recombinant, totally egg-free, that I can use in those patients. So we do have many, many more options now, both as individuals and as healthcare workers promoting influenza vaccine. So thank you.
Thank you, Kathy. That's a stirring affirmation. Dr. Swanson, please.
Hi, I'm so glad to be here and share my opinions and ideas. I come about this as a practicing pediatrician, but I also come about this as a mom, as a daughter to people with chronic illness, and I come about it as a blogger. We live in a really different time with how we get information and how we build partnerships with evidence and with science. And the great news is that parents and families who are making decisions about vaccines, they trust their pediatrician and their healthcare provider most. They lean on their spouses and partners when making vaccine decisions, but they're certainly online and connected. So we know without hesitation that the 3 tiers of washing your hands, staying home when you're ill, and of course being vaccinated are essential. But we also know now too that all children over 6 months of age should get a flu shot every year. We know that there's continuing build of immunity over the years, and we know that children who are under age 5 are more likely to be hospitalized than older children. So there's a group that's more vulnerable, and those are the kids that go to preschool, that go to daycare, that go to kindergarten, they swap spit and snot and saliva. These are the kids, right, that are exploring the world with their curiosity and advancing. They're also the ones who can get so sick from influenza. There's no question that in my practice as a pediatrician, I've seen kids not have their parents make the decision to be vaccinated and get influenza. I've seen children who've had febrile seizures during a course of influenza. I've seen children with wheezing and asthma have serious cases of influenza, lose 10 pounds, be out of school for 13 days because they're scared of a needle. Just like we're learning, we've got so many choices now, particularly for kids over age 2, who can choose the nasal spray as a great option. So we have all sorts of choice, we have all sorts of data, and we want families to know this is just a part of being a kid. Like I always say, snot's a part of being a kid in the wintertime. A flu vaccine in the fall is also a part that we want for every family. And we know that parents' intention to immunize really is driven by protection of their own children. But we also know the great and profound benefit that kids who go to schools or live in communities that are better immunized are less likely to get infections that are protected by those immunizations. So we've got this kind of bold and new task to make sure that all families understand this is an every year thing. We know that patients and families have really good trust, particularly when they're vaccinating their children. We know 9 out of 10 families in America follow the guidelines and recommendations for getting vaccines on time. It's few who actually choose to delay or space them out. And when we look at influenza vaccine, we know parents really want to protect their babies and toddlers. In fact, 75% of infants and toddlers were immunized against influenza last year. And just like Dr. Frieden mentioned, we know that children die from influenza every year. Last year, over 140 children. And the harsh reality, it isn't only children with underlying risks, being very young, having things like asthma or wheezing, having chronic conditions like diabetes or neurologic conditions. We know on average about half of the pediatric deaths happen in healthy, well children who get exposed to a virus and have a bad course of that illness. So as my job as a pediatrician, a mom to 2 little boys, we get immunized early. I want to partner with patients and families to get them information in arm's reach. So I use Twitter, I use Facebook, I use my blog, I partner with the Academy of Pediatrics, and I listen to what people say online and try to get them the science that we have that we know can protect them. The other thing that we should mention is that we do, of course, want all healthcare providers to be immunized. We used to wear buttons that said, I got my flu shot today. Now I recommend that all of our physicians, staff, medical assistants, receptionists go online to Facebook when they get their flu vaccine and tell the world that they've done it. And we know that so many organizations across the United States and healthcare facilities are even asking all workers if they're going to choose to take the privilege of caring for children who are ultimately a vulnerable population, that if they're going to do that and work in a hospital, they have to be immunized against influenza. So we have great protection, and we have just great opportunity to prevent illness, missing work, high fever, discomfort, and pain with a great vaccine. That's it. Yeah.
So let's just say a few words about pneumococcal vaccine. Pneumonia is the major complication of influenza, and the principal bacterial cause of that pneumonia are the pneumococci, that bacteria. As Dr. Frieden said, pneumococcal infections can affect anyone but are particularly deadly in older persons. And as you would expect, those at highest risk are the same people recommended for pneumococcal vaccination. These are somewhat more complex recommendations, so it bears emphasizing briefly who these groups are. Everyone aged 65 and older is eligible for pneumococcal vaccine. Adults 19 to 64 with certain chronic illnesses such as diabetes, heart disease, lung disorders, and smokers. Infants and toddlers are also at highest risk, but they tend to be well vaccinated because pneumococcal vaccine is part of the routine immunization series for children. There are 2 types of pneumococcal vaccine recommended for adults: conjugate, we call that PCV13, Prevnar, and polysaccharide vaccine, PPSV23, called Pneumovax. The specific recommendations about which vaccine or vaccines to get depends on a person's age and medical conditions or their risk factors. What we want people to know is, if you're in one of those groups that I mentioned, ask your healthcare professional which vaccines you need to protect yourself from pneumococcal disease. These vaccines work. In March of this year, a new study in the New England Journal of Medicine reported on the effectiveness of PCV13, the conjugate vaccine, in those aged 65 years and older. There was a significant reduction in vaccine-type pneumococcal community-acquired pneumonia in those vaccinated with PCV13. The study was large. It included 85,000 adults aged 65 years and older with no prior pneumococcal vaccination history. It's quite a definitive study. Together, these two pneumococcal vaccines give adults broader protection against pneumococcal disease than either vaccine alone. Medicare will pay for both types of pneumococcal vaccine in full, no copay or deductible, as long as they are given 1 year apart. You do not get both pneumococcal vaccines at the same time. However, you can and should get flu and pneumococcal vaccines at the same visit if both vaccines are recommended for you. And then you can get the other pneumococcal vaccine next year when you come back for your annual flu vaccine. So this 1 year timing interval works well both scientifically and practically. And finally, if you're an adult who was vaccinated with one type of pneumococcal vaccine, once again, talk to that healthcare provider to see if you need the other type as well. So at this point, thanks again to all of our panelists. It's great to hear that nearly half of the U.S. population is making flu vaccination an annual event. More is better. We're clearly making progress, and we still have a way to go. The National Foundation for Infectious Diseases is again inviting healthcare professionals, business, and community leaders to lead by example and make influenza prevention a public health priority. And our friend Dr. Frieden will be the first to lead by example by getting his flu vaccine today, right now. Tom?
All right.
Bravo.
Easy.
So thank you, Dr. Frieden, and thank you, B.K. Morris, the nurse who was here with the MedStar Visiting Nurses Association. And you know you're all invited after the news conference. We will have influenza vaccine available for all of you, and MedStar Visiting Nurse Association is happy to provide it. Now, let's have a little question and answer. The Q&A portion of the event is reserved for questions from you all in the media. We have 2 roving microphones. Please indicate if you have a question, and one of our staff will get it to you. And if you would just identify yourself in the media outlet when you make your comments. For the media participating via the webcast, please email your questions as indicated on the webcast. And if you're on the teleconference, the operator will come on the line momentarily to advise you about how to submit your question. And finally, if you would like to speak with one of the panelists one-on-one, we can arrange that after the Q&A session. So thank you very much. I'd like to now open the question and answer session. Is there somebody here who would like to ask a question? Lauren.
Lauren Niergaard with the Associated Press. I have 2 questions. First of all, I'd like to get all of you to address the autism and vaccine statements that were made at last night's presidential debate. What do parents actually need to know about that? And then after that, I do have a flu-specific question, I promise.
So let's deal briefly with the autism issue. I think everyone in this room knows that there is an abundance of scientific evidence indicating that there is no connection between the administration of vaccines and autism. Likewise, the currently recommended schedule for immunizing children, recommended by the CDC, the American Academy of Pediatrics, and the American Academy of Family Physicians, clearly is effective and it is safe. I think we can talk about that a little bit more offline, but let's go to your flu question now.
Could Dr. Frieden address that?
Wendy, Sue, actually, we might take this opportunity. You're here on the behalf of the American Academy of Pediatrics, and they actually have a brief statement on this issue. So
We do, and just to respond, certainly there's lots of chatter about comments that have made, and this comes in waves in some ways because we share sometimes scary anecdotes that may not reflect what science actually brings to the table. You know, the great, wonderful benefit of living in a time of science is that you can aggregate all sorts of anecdotes together and come closer to truth. So I think what we know is that there were comments that were made about the purported link between vaccines and autism. We know that no science has ever proven that link, including, you know, an Institute of Medicine report that studied over 1,000 studies and came out on the side that vaccines are certainly far more beneficial than the risk, and no link was purported. You know, the other really, I think, follow-up point that came in sound bites is really that somehow an alternative or spaced-out schedule is a good idea. What we know about that is that's an untested schedule. We have not a single study that demonstrates spacing out or delaying vaccines provides any benefit. In fact, it's the same amount of risk, the same vaccines, and more risk because the window of time that children and those in their community could be exposed to illness is bigger. So I'd love to read the statement from the American Academy of Pediatrics that was released today in response to the comments from last night that addresses both your question about the purported link between vaccines and autism and alternative schedules. Quote, the American Academy of Pediatrics would like to correct false statements made during the presidential debate last night regarding vaccines. Claims that vaccines are linked to autism or are unsafe when administered according to the recommended schedule have been disproven by a robust body of medical literature. It is dangerous to public health to suggest otherwise. There is no, quote, alternative immunization schedule. Delaying vaccines only leaves a child at risk of disease for a longer period of time. It does not make vaccinating safer. Vaccines work, plain and simple. Vaccines are one of the safest, most effective, and most important medical innovation of our time. Pediatricians partner with parents to provide what is best for their child, and what is best for children is to be fully vaccinated.
And Bill, just to say further that at the Centers for Disease Control and Prevention, one of our centers is the National Center for Birth Defects, and so much of the nation's data on the trends in autism come from CDC. It's a serious problem and one that we're analyzing and helping to link parents to services. Study after study have concluded that there is no risk between vaccines and autism. There is, though, a very serious problem of autism, and the discussion of vaccines and autism, unfortunately, has at times interfered with our ability to study further what is causing autism so we can both prevent it better and provide better services to the children and families who have autism.
In light of what happened last year, with all of our pandemic preparations, what now could make us more nimble in responding if we have a situation like that again where you are able to see that a problem is brewing with a mutated strain?
Well, there are three things that we do to try to minimize the risk that if flu changes, we won't be adequately prepared. First, we are better tracking flu in this country and around the world so that when it changes, we identify that in as close to real time as possible. Unfortunately, last year it changed when the flu vaccine was already being made. So at that point, there was nothing really that could have been done practically. The second thing we're doing, along with manufacturers and other entities, is cutting down the time it takes to make a flu vaccine so that we can start making it later in the season and still have, as we do this year, more than 171 million doses, enough for everyone who wants to get a flu vaccination. The third thing that we do is have a second line of defense, understanding that even in a well-matched year, flu vaccine, although the best way to protect you is only 60% or 50 to 60% effective, is particularly for those with underlying conditions or severely ill with something that may be flu, to encourage treatment with antivirals, which may keep you out of the hospital, reduce your duration of illness, and reduce your severity of illness as well.
Thanks, Tom. Questions? Wendy Sue, we didn't talk really about the importance of protecting pregnant women. Would you like to say a few words about that?
Yeah, I would. So, I think one of the things every expecting parent does is get really excited about a long life for their child. And, we know without question that pregnant women are at higher risk for complications from influenza because of their immunocompromised state during pregnancy. We also know when moms immunize themselves, they do two things. They protect themselves, and they also provide protection for their baby after their baby is born. So we know that in addition to providing the cocooning, so if mom is immunized against influenza, if dad is immunized against influenza, after the baby's born, much less likely to bring it home. But secondarily, when moms get immunized during pregnancy, any time during pregnancy, they start to develop antibodies that go through the placenta and transfer to the baby, so that in the first 6 months of life, when babies are high risk, but also too young to be immunized, they're better protected.
Excellent. Actually, we have partners here from the American College of Obstetricians and Gynecologists. Dr. Riley, why don't you stand up for a moment, let the people see you, and I know you would like to reinforce those messages. Go ahead.
Absolutely. Thank you for the opportunity. I'd love to reinforce that we really encourage all pregnant women to be vaccinated at any trimester, first trimester, second trimester, third trimester. Get the vaccine. You'll protect your baby as it's growing inside, and importantly, you'll protect your newborn in the first 6 months of life before that baby can get its own vaccination. And the other thing I think is really important, as many have said, is that there's tons of data to suggest that this is a safe vaccine, and I think all pregnant women, particularly pregnant women and their families, are always worried about the safety of anything, any medication, any vaccine, but we have great data to suggest that this is a safe vaccine, and certainly it is offering great protection. Thank you.
Thank you. Thank you, Dr. Riley. We have some questions on the phone.
Yes, sir. The first of which is from the line of Liz Sabo with USA Today. Please go ahead.
My
Hi,
question's
Liz.
been answered. Thank you. Hi, my question's been answered. Thanks.
Okay, thank you very much. And then I have some questions here. Let's see. So perhaps we could have some information about how many vaccines have been shipped already. And we anticipate that we will have an abundance of vaccine, and vaccine is coming in. Tom, do you have some comments about that?
So simply that there are, we believe, more than 171 million doses of vaccine being produced this year. More than 40 million have already been distributed. As is usually the case, you may have situations where in some areas some of the vaccines may not be available for some of the time, but in general there will be enough vaccine for everyone who wants it. And as there were last year, and as was mentioned earlier, there are lots of options for different vaccination types. Intradermal, a tiny needle. I will say the needle I just got wasn't intradermal, but I still couldn't feel it. There's also the intranasal vaccine, and we don't have a preference for any of the vaccines from CDC this year.
Excellent. So I have another question here. This is from Anna Almandiva from the Huffington Post. So we're offering vaccines currently, Kathy, but she wants to know, is it too late to get vaccinated at any time during the influenza season?
Yeah, that's an excellent question and a very common question. We heard from Dr. Frieden the total amount of vaccine available, but we know the availability at the local level can sometimes be quite different. So the short answer is no, it's not too late to get influenza vaccine. In fact, if you sort of tease out some of those data that Dr. Frieden presented, it's interesting. For pediatricians and other providers of vaccine to children continue to give vaccine through the whole year. But adults tend to get vaccine by November or not get vaccine. So our message here is the soonest you can get it, the better. But it's never too late to get influenza vaccine. There are years when influenza may not circulate till February. There are years where we may have a lot of flu in December, and then it comes back again in March. So give vaccine, give it through the season, continue to give influenza vaccine, and in fact, it's not too late to give influenza vaccine in October, November, December, January.
Excellent. So we have a note here from Sonia Collins from Pharmacy Today. She's directed the question to Dr. Frieden. What guidance do we have to the public regarding the various members of what we call the immunization neighborhood? Where can we go to get vaccinated against flu, pneumococcal disease, and indeed other vaccines, Tom?
Now, in every state in the U.S., pharmacists can vaccinate against influenza and in many states against other diseases as well. The key about vaccination is making it easy for people, reducing the barriers to vaccination. And that means that if you're at your doctor's office, at your nurse practitioner's office, if the doctor or nurse provides a vaccine, or your pharmacist, these are all great options to get vaccinated. What we're seeing is very interesting. We're seeing increasingly convenient vaccination options for Americans. Many Americans are now getting vaccinated in their workplaces by doctors or nurses or pharmacists. In fact, this is really important, and one of the reasons this is happening is that businesses recognize that vaccinating their employees is really good business. It means fewer sick days, more productivity, lower healthcare costs. Flu vaccination is a best buy for healthcare providers and for businesses. We're also seeing more minute clinics or small clinics in pharmacies.
For example, just in that year period, there's protection. And then a second question, and this can be for all of the doctors, whoever would like to answer, what do you say to people who are reluctant to get the vaccine because there's this thought process among some people who say, if I get the vaccine, I'm going to get sick, I'll get the flu?
No. If you get vaccine, you won't get the flu. At least the vaccine is 50 to 60% effective. That's a myth. I think we can all sing this in harmony. You can't get flu from the flu vaccine. Thank you very much. And it's important to keep reminding people about that because, quite realistically, it's one of the most common questions that we do get asked. So Miriam Falco here.
Do you want to answer that first question?
Oh, sure. Go ahead, Wendy.
And I think,
Dr. Swanson, please.
Yeah, I'd love
That's
for backup from both of the other docs here too. But part of the reason we recommend, for example, the rules around kids 6 months of age to age 8. If you haven't had 2 doses before, you get 2 doses because you build immunity that way. We know even with drifted strains, there's still some partial protection. So even when there's not a well-matched vaccine, we know we get partial protection, are more likely to have more mild illness than more severe illness. So there is benefit to the kind of essential part of an annual vaccine that over the years you're building up immunity in a community to influenza.
All right, guys, we're going to leave this because we're going live now to downtown where Sheriff Joe is speaking.
South America, head of the DA here, and I have to admit that in recent years we all want to get the big guys. Well, we got to get the street dealers to selling to our kids, causing havoc. If you look at the history recently, you'll see every time there's a violent crime, it looks like there's a drug background across our nation. Now, one thing I wanted to prove a point, since we also run the jails, and everybody booked by law enforcement comes through these doors, so we have the luxury of looking at the statistics of everybody arrested in the county. And I wanted to get a history of how many of these inmates are there for drugs or have drug-related crimes. And the statistics, out of 26,000 that we checked on, 7,000 were in this jail, or are in this jail for drugs. 7,000. And of that, 5,000 had other serious crimes. Murder, domestic violence, burglary, you name it, they have a drug background. So the bottom line is, if we could do something about the drug problem, we would reduce the crime problem. But the bottom line, I have a special unit with our narcotic detectives, the posse, analysts. We're going to hit the streets, and we're going to arrest anyone that sells drugs on the streets, around the schools, you name it, and put them in jail. I have a passion for this because I know what the drug use and drug activity does to our young people, causes criminal activity, causes violence, and something has to be done with it. So I'm going to do it. This operation will probably be 3 months long, and we'll keep it going. But let me tell you one thing, we're still going to arrest the major traffickers, most of the drugs coming in from Mexico. But my big concentration right now, the streets of Maricopa County. That includes Phoenix, every city, every area in this county, and I feel that we will send a message when we come in with our final statistics to prove a point, the big drug problem we have in this county. Now, heroin is coming back. That's a big issue here in Phoenix, across our nation. So we can't just talk about it. In my experience, heroin is back. The White House will now start talking about it because the people are concerned. So everybody's going to be concentrating on heroin, and they'll forget the other drugs. You got to hit all the drugs, not just one drug. So that's the message. And we'll see what happens on the arrests in 3 months. If we get anything exciting doing this operation at Nashville, I'll let you know.
When do you guys begin it, and how many people are you going to put in?
Can you hear? I couldn't hear you.
Now.
Okay, what's the question? How many people?
The question is, how many of your deputies and posse members are you going to put it in?
Well, we figure maybe about 50.
50 altogether,
Yeah.
a combination?
Posse, analysts, our narcotic detectives are there anyway. We're just switching the priority a little to hit the streets.
When do you start?
Pardon?
When does it begin?
We started it, I believe, last week. Another thing important when you hit the streets, you pick up intelligence, you pick up informers, so you never know where that activity is going to lead you to solve other crimes, because we do know that 60% of the criminals in there have a drug background. So if you hit the drugs, who knows what are the crimes we will solve in the process.
Sheriff, what's your stance on diversion programs for first-time offenders?
The what?
Your stance on diversion programs for first-time offenders?
You know, that's another issue. My job is to put them in jail, and that's another program they have. But we'll see how that works.
When you took on illegal immigration a couple of years ago, like 10 years ago, I guess, you would explain to me that you guys were going to go after smugglers and not the immigrants, and you used a parallel to the drug world. And what you said is, we don't go after the little guys. We go after the drug dealers, the people who are supplying this, because you can make more of an impact on it. So what changed?
Well, that was
Want to go after everybody?
that was done when we didn't have the state laws on human smuggling and the employer sanction. We didn't have those laws.
Yeah, but why go after? It sounds like you're not just going after the drug dealers now. You're going after everybody connected to it, right? No bus too small. So what changed over the years?
Well, we're not going to. You mean on the drugs?
Yes, yeah.
I never said we are only going after major drug dealers. I've always said we have to hit the streets too, but now we're going to concentrate on it. So you're saying I said we go after the big guys?
Yeah.
Okay.
Yeah.
All right. Even if I did that, that's really what we all law enforcement wants to do.
Yeah.
But I'll tell you one thing: we're being flooded with drugs on the street, and crime is going up because of the drugs, and people are shooting each other that have drug backgrounds, including police. So we have to do something with the street dealers. I'm not going after the users. We're going after those that are selling drugs on the street level, not the users, unless we catch them during the course of our operation, investigation.
Why not the users?
Channel 3?
Yes, sir.
Who said why not?
Why not the users?
You know what? We're not going to concentrate on users unless we come across it. I want the dealers. I want the people on the streets selling drugs. And the point is, it doesn't have to be 10 kilos. I don't care what it is. It could be $15 worth. But if they're selling drugs, they're going to jail.
What areas of Phoenix do you plan, or what areas of Maricopa County do you plan to focus on for this operation?
Well, everywhere. We can't be everywhere, but our jurisdiction is all of Maricopa County. Of course, we're not going to Gila Bend to get a guy selling $5 worth of marijuana. You know, Gila Bend is the big guys. We'll be there too. We run some task force, big task force, to go after the big guys. But I want the street dealers. And I know once you concentrate on street dealers, you're going to reduce this problem if they stay in jail. And you're going to solve a lot of other crimes because they are involved in other crimes, including murder. I can go sex. I can go right down this list. Drug connections with crime.
Let's say if you weren't to go after the big dogs, you're going after the street levels, they get incarcerated, the big dogs just find more people to deal drugs, and now all of a sudden you're breeding more drug dealers.
Well, that's a defeatist attitude. We know that we're not going to stop the drug traffic. I've been in it 50 years. It's still there, right? But my point is, again, we want to not give a pass to these people selling drugs on the streets, especially around schools and other areas. I don't care if it's in the center of Phoenix, Fountain Hills, no matter where it's at. And we're going to pick up a lot of information. You see my my hotline there. Very successful. We're arresting people off that hotline. People are calling in. They're fed up with this drug problem. Very successful hotline. And we're going to keep that thing going. And I put those signs up there about 3 months ago, knowing that I needed information from the public to catch these people.
Your critics are saying that this is being launched before your contempt hearing to divert attention away from the bad stuff that's going to come out of the hearing.
Well, you know, they could say what they want. I've had so many hearings. You think I'm going to stop my job? I must be pretty good in doing programs right before hearings, like animal abuse. We have these things lined up. This thing has been lined up for 3 weeks, and this date was picked. Had nothing to do with courts. We had to find the statistics. It took a little time to go through all these stats to find out what we have in the jail.
You said it would probably last 3 months.
Pardon?
You said it would probably last 3 months, the bus. If it goes so well, would you extend it? Like if you were catching a lot of the dealers?
If we catch a lot of dealers, what?
You said the program would probably last 3 months, but if it goes so well,
Yeah, we'll keep it going.
okay.
But we're still going to catch the big guys too. It's a little special for me. As I say, I'm very adamant to go after the small guys. Why should they have a pass? They're selling the poison to users. So they shouldn't have any pass just because it's not a big seizure or a big case. In my enforcement career, sometimes you start from the bottom, you go up the chain. That's how you do it in narcotic enforcement. You need information, intelligence. That's how you do it. You get to the big guys from generating activity on the streets, and you go up the chain. If you can't go anywhere, anyway, they're going to jail.
So drug crimes are increasing, and that's what prompted you.
Well, the sales of young people, but recently I've been, every time I go somewhere, the parents come up to me. Sheriff, they're selling drugs to my kids in school, on and on. Now we have the heroin epidemic that's coming across the nation. I think in New Hampshire, they had some political activity there recently, and they asked the question, what's your top priority? It wasn't economics, it wasn't illegal immigration, it was heroin. The New England states are fed up with the heroin killing their kids. That's their concern.
Have you noticed a heroin problem in the metro area?
Yeah, it's moving up here. Yeah, we make heroin cases quite often. I'm not talking about the big ones, we do that. I'm talking about on the street.
And you noticed an increase of drug usage?
Yeah, it's increasing here. All comes from Mexico.
The Somos America Coalition and Black Brown Coalition are having a town hall meeting at 6 p.m. specifically speaking about the court hearing to your case. Any statements before this, Sheriff?
Who's having a meeting?
Somos America Coalition and the Black Brown Coalition are having a town hall at 6 p.m. Any statements regarding...
Of course not. Who are they? Is that another organization?
Well, what about the upcoming hearings next week? What do you have to say about that?
Nothing. That's the way it is. I'm still doing my
You don't
job.
think there's anything that anybody in the public needs to know on your behalf? before
No,
they start reading stories
no,
about this?
I'm not talking about, I never do talk about that court case. I know the Department of Justice dropped their case. We signed a couple of agreements. So we got rid of that one after 6 years, 7 years. So that's gone. That was the Department of Justice have been hanging around for all those years. So that's gone.
Sheriff,
No, it's
about the correctional health services and the jails being reaccredited. Do you have anything to say about that?
You mean the best run jail? Is that what you're talking about?
Yeah.
I think that's very good. We have something to do. We run this jail. So that's great. Being known as the best run jail in the country, I think that's rather commendable.
Is there a concentrated effort to gain that reaccreditation from 6 years ago?
What?
Was there a conscious effort to regain that accreditation?
Yeah. The correctional health worked hard. I don't, you may not know this, I'm not in charge of the correctional health. Those doctors and nurses come under the county, not me. But they're in the jail. We work together with the nurses and the doctors. But I don't have management supervision. Of course, if they do something wrong, I can remove them from the jail. But they're a separate entity under the county. So I got to give them credit, too, for getting this certification back. Thanks for asking.
Sheriff, I've got a question about Michael James Rogers.
About what?
About Michael Rogers, who was just on his IA this morning, and he's the one that's accused of shooting the officer. Do you have him on your suicide watch? Do you have any special accommodations?
For the guy that shot the cop? Do I have special? Yeah, he's
Is he on your suicide suicide watch? Are you
No,
monitoring?
he's in isolation. He's not on suicide watch unless we feel that that could happen. So he's in there. We've got a lot of other people in there, about 8,300, which makes us the third largest jail and sheriff's office in the country. So it is a large. And I'm going to leave one more thing. I don't want to hear anybody say, which I'm going to hear, oh, Sheriff, you know, you have room in the jails? Yeah, I got plenty of room. I got a tent city over there that I have plenty of room to incarcerate these people. So I don't want to hear anything of jail overcrowding, you don't have room, you're tying up all your beds with drug dealers or small dealers.
What about staffing changes?
What?
Staffing changes? Is there accommodation?
In the jail? Oh, I don't know how many more we're going to get. We're up to like 8,300. We'll see. We'll see how long they stay in jail. But they're going to be put in jail.
Are there other changes to officers' duties in order to track down low level of drug
Well, right now, I don't see any. If we get 1,000 people, we may have to look at that. But we have 1,000 beds ready in the tents too, if we have to, or even in the jail. So I don't want to use the jail as a reason not to concentrate on street dealers because of jail incarceration. These are our cases. The cities don't have to pay. They pay us when they arrest the people. We're paying for that, for this, what you're talking about, out of our budget.
I know you guys don't like to reveal your investigative methods, but can you characterize to me how you guys are going to actually go after these guys? I mean, these street buys, I just want a sense to be able to explain to somebody how you guys...
But you know, I don't want to insult you, because I'll insult myself too. You and you want to go on the street? You think we can't score some drugs?
Yeah, but I'm just wondering how you guys...
I say that because it's so prevalent out there. So we have, that hotline is very critical. We keep getting calls and tips.
You respond to that?
So, you know, in law enforcement and drugs especially, you do undercover work, surveillance, information, intelligence. So it's a space, there's no secret. That's the basic way you
So it's a combination of all this that you guys can do, right?
whatever comes to our attention. And I want to thank all of you for being here, for putting this out. And I would hope that you look at our truck and kind of put that hotline number on there so we can get more information. I'm not going into universities. Well, that's something important. I'm not going to go into the schools right now to make buys. But we may be around the schools because I'll tell you, they got problems in the schools. You know that, I know that, and it's sad that these young people are using drugs. So the least we can do is get rid of those dope peddlers that are selling to the kids. So you're talking to a guy that's been around drug enforcement my whole life for 50 years, and here I am as the sheriff, getting up there in my career, and now I'm back to have a passion to do something about the drug problem. It's like going around in a circle. I've been doing this my whole life, but I don't like what I see around here. I don't like what I'm seeing.
Anybody got any more questions about this operation? That's it?
Hey, thanks for coming. Thank you. I hope you learned how not to do a press conference. These are our future journalists. I have great faith in them. They're up and coming. What was it, Cronkite? Great school. You know, I talked before. They had me with a Arizona hat. Remember that when I was interviewed on the stage? They were going after me. So I talked in Cronkite before a big crowd on a debate. with your school director. I didn't do that. I didn't do it. I didn't touch it.
That better not be mine.
Channel 12 has a lot of money.
Sure, how you doing?
Oh.
How's everything? We got here late. As
You'll make
usual.
the story up anyway.
Sheriff, I was wondering, I'm sure, you know, you were asked during a press conference, but...
This isn't my lecture.
And I know, you know, there's some
The
things you
answer's
can't
no.
talk about.
The answer is no. This is for drugs. Would you like to talk about drugs?
Well, I want to know about the taking it to the Supreme Court. I want to know
I'm not
about
talking about nothing except drugs. This is a drug operation. Did you get the...
We got the press release, but we're working on a different story, so I just wanted to get your side. I know there's things you can't talk about.
We're doing the drugs right now. If you want to talk about that, you have to wait, and we'll get to it after the phone, okay? Let him talk to everybody else about the drugs, and then...
You want to do it in Spanish?
If you, that'd be great. I've been trying to get him to speak Spanish.
Rico's not here. Anybody else got drug questions about the operation?
I've got a side little thing. Ned Foster is retiring. We're going.
Ned is. Wait a minute. He's not the.
Yeah, he's the news guy for the.
No, you're thinking of
That's the other Foster.
He was the morning news anchor, wasn't he?
He's the morning news anchor, so we're going around to different newsmakers.
Morning newsmaker? What channel?
KTAR.
Oh, the radio.
Yeah.
So we need to get a thank you from all
Can I
these
get into it?
newsmakers.
Yeah, but he wants something on tape from you saying
Oh,
to him.
oh, okay. Ned Foster, he's the morning anchor?
Yeah,
News anchor.
Morning news anchor. Just a little
He's
thank
been there
you.
for years.
He's been there for like 20 years.
Yeah.
20 years?
He has
Okay, let's go.
Check, check. All right, Sheriff.
Hey, Ned, why are you retiring? I've been around longer than you, going on 24 years. Have you chickened out? If I can go 24 years as a sheriff, you can go 24 more. So we're going to miss you. You've done a great job, and I wish you luck on your retirement.
Perfect, Sheriff. Thank you so much.
Thanks, buddy. Take care of yourself.
Thanks, man. Good seeing
Who
you.
else? Anybody else on drugs?
Wait a minute. We don't need him to surrender. You said on drugs?
Yeah, we want to know if anybody's on drugs. That's right. Turn yourself in.
Admit
If
yourself
you're on drugs,
right now.
right here you need to be. Anybody else I got questions about the drug operation?
Can I just right one word about?
Yep.
How are you?
All right, guys. Now we're going to go live to an event where Vice President Biden is speaking at. Let's go ahead and listen to what the Vice President has to say. Looks like Biden's in Ohio. Interesting.
Mr. President, it's good to be back at Ohio State University, the Ohio State University. I'm here with a really good friend of mine, a guy who's been loyal to all of you, and I think will go down in history as one of the great mayors in the 21st century, Mayor Coleman. Stand up here. Stand up. And since I was in Detroit today doing an economic, Detroit's getting up off its back, onto its feet, fighting back as one of the great American cities, and the greatest champion for that state happens to be somebody who went to that other place, but she's wonderful. Debbie Dingell, Congresswoman Debbie Dingell is here. Mr. President, you are a president of not only the largest, one of the great institutions in the United States, one of the great universities in the world, and that's not hyperbole. That's a fact. That's a fact. OH! You know, I'm surrounded by a bunch of Buckeyes on my staff. I got to tell you. As we were landing, no, this is God's truth. Excuse my back, by the way, folks. As we were landing, my staff came into me, a guy named Greg Schultz, who's an alum here. A little embarrassed, he said, Mr. Vice President, you have on a blue suit. I said, yeah, what the hell's it to you? I have a blue suit on. He said, you have on a blue shirt? I said, yeah. He said, with all due respect, sir, take them off. You think I'm joking? See this tie? I swear to God. I doubt whether any other vice president in American history had his staff tell him how to dress. But you know what? I'm surrounded by Buckeyes. My neighbor, our porches back up onto one another. There's a little bit of woods, but it's a clear shot between us. His name is Dr. Solikoff. He's from Upper Sandusky, a board-certified surgeon. He's a proud Buckeye. He's real passionate. I want to tell you, every single game you win, I know about. No, wait. Not an exaggeration. His back porch, the veranda, faces mine, about 120 yards away. He has a 10-foot, it seems 10 feet, maybe a little more or less, banner with the Ohio State flag, and every game you win in football and or basketball, it is hanging out. I don't need the sports channel to know how you're doing. Oh, I'm not joking. I called him and says, okay, mention your name, Doc. He said, please, please, please. We used to have 3 or 4 beautiful Leland cypress trees between us, off to the side. He called me up this last spring. He said, Joe, you mind if I cut them down? I thought, okay, what's that about? He said, I want to plant some other trees. I swear to God, this is a true story. He cut down 18-foot Leland cypress and planted 3 Buckeye trees. Swear to God. My best and closest friend in the Senate, who I served with over 30 years, Tom Carper, all he talks about is being a graduate of Ohio State University. I tell you what, and Congresswoman Joyce Beatty, who wanted to be here, pointed out to me, as I said I'd shout out for her, that she used to work here. I tell you what, man, if I didn't know better, I'd begin to worry. I'm very proud of graduating from the University of Delaware, but no one pays attention when I'm around y'all. And to both the Abbeys, I want to thank you for the introduction, and along with Michael, thank you for doing a great organizational job and representing your fellow classmates. And to Josh let me fly in his plane today to get here. I kind of thought Air Force 2 was my plane. But as I got on, every woman on the plane all of a sudden had no interest in talking to me about anything, including my 4 granddaughters who were not on the plane. Josh, thank you. Well, you know, there's a lot of celebrities, a lot of good folks who care about and engage in support for a lot of causes. But with this guy, this cause starts in his gut, goes to his heart, and then to his head. I trust people who feel it and taste it before they think it. This guy's the real deal. He's in on the deal. By the way, when you heard I was coming here, he's in the middle of a hectic production schedule. I don't know what the hell that means, but he's in a production schedule, making another, I don't know whether it's a film or show. I'm not sure which one it is. And he dropped everything. He dropped everything because he wanted to be here. He got up at 5 a.m. this morning to fly with us to be here, and he means it, he understands it, and he gets it. Folks, you know, this issue of violence against women in America has been my passion for a long time, and a lot of people think it's because maybe something happened to my mom or my sister or my wife or my daughter. It's because of my father. My father had an expression. My father was a truly graceful man, a gentleman. And my father used to say, and I mean this sincerely, I give you my word as a Biden, he said, Joey, the cardinal sin anyone can commit, any man can commit, the cardinal sin, is the abuse of power. And the ultimate abuse of power is a man to raise his hand to a woman. That's why I wrote the Violence Against Women Act 20 years ago. You'd be amazed. You'd be amazed at the time, because of students like you 20 years ago, we got through, but you're amazed at the pushback I got. If you go back, and my wife as an English professor would say to me, go back and Google it, you'll see that I was pilloried for introducing the legislation. I was told, and these are from mainstream sources, and particularly some religious organizations, I was told, you don't understand, Mr. Vice President, this is a private affair. This is a family matter. When I drafted legislation that provided shelters for battered women, they were referred to in some of the mainstream press as women indoctrination centers. Not an exaggeration. Initially, none of the women's groups supported my legislation because they were worried it would trump issues relating to choice and gender. But because of a woman who led now, a woman named Ellie Schmiel, in a long meeting we had, president of Now, she finally looked around at 8 other groups around my conference table and said, what are we doing? Why aren't we there? The people who generated the support were the women in the field running the rape crisis centers, the women in the field providing for shelter for women who were abused. You know, 7 out of 10 children who are on the street are there because their mother is a victim of abuse. Over 70% of women who show up in an emergency room with a bruise, a cut, a broken bone are there because it's the hand of a man. And it used to be docs didn't want to ask the questions because they didn't want it to get complicated. And so what we did, I was determined and convinced that the vast majority of the American people like you, good, decent, honorable people, but they didn't want to look at this ugly face, this ugly side of American culture. This is the most heinous crime that can be committed. So what we did was, and it was controversial at the time, what we did was we had hundreds of hours of hearings. And what began to change things, and I was convinced it would, if we could find brave, and I mean this sincerely, brave young women who have been victimized to come and stand before the Klieg lights in my hearings in the Judiciary Committee with millions of people watching and paint the picture of what happened to them, forcing America to look at this seamy side of our culture. I was convinced Americans would not be able to turn away. What they testified to was how they were abused, but then how they were re-abused. The phrase one woman used, I was raped and then I was raped again by the system, the legal system, the political system, the healthcare system, and the court of public opinion. All bystanders to the fact that women were suffering perhaps the most pervasive form of violence in the world. At its worst, these institutions re-victimized victims. I got legislation passed because of a young woman who was brutally raped, but because she sat in a bar stool with a short skirt on, the judge said she was asking for it. We're asking all the wrong questions. No judge, no police officer, no friend, no one has the right, if you've been abused, to say, what were you wearing? Why? This is important. This is important. I appreciate your support, but this is important for America to hear. It's never appropriate to ask, what were you wearing? Why were you there? What did you say? What made him think? They're all the wrong questions. The question we as a nation have to ask repeatedly is, what made him think he had a right to raise his hand? That's the question. And what became clear to me, and is clear today, is we should pass some laws, but the fundamental problem is part of our cultural problem. You guys know what the phrase rule of thumb means? Under English common law, in the early 1400s, too many women were dying and being beaten to death by their husbands because they were a chattel, property. That's our jurisprudential history. So the court ruled that a man could not beat his wife with a stick bigger than the circumference of his thumb. That's what rule of thumb means, a phrase we all use. That is its origin. So we've been fighting for a long, long time to begin to change attitudes. What we have to do, there was a young woman, one of my first witnesses, who was a student, a freshman in orientation at a small college just north of Pittsburgh, about 8 miles north. And they had an orientation period before their first big game. It's a very small school. They had a bonfire. And she was, I'll never forget her testimony. She was, went to the bonfire, it was chilly, and she was going to walk back to her dorm alone. She'd been on campus 2-3 days. And a man who was an upperclassman, who was a friend of one of her classmates in high school, was her friend's boyfriend, said, "I'll walk you back to your dorm." She said, "Thank you." And on the way back to the dorm, he said, "I want to stop in and get a jacket out of my room. Walk in with me." He dragged her in the room and he raped her. She ran back to her dorm, and I remember her saying, "I'm on the 4th floor." And the first thing I did was jump in and take a scalding shower. I was sitting on the edge of my bed crying, and the RA, the resident advisor, came in and asked me what happened. And I told her what happened. And she said, "You've been raped." And I looked at her and said, "No, I knew him. I knew him." Think of the cultural circumstance would have a young woman victimized think that rape only meant if a stranger, this is an educated woman. She started the first major effort for survivors on college campuses. She's a leading advocate today. Where there was a beautiful young, your parents will remember this, there was a young model named Marley in New York. Her landlord kept asking her out and harassing her, and she wouldn't go. And all she wanted was, she had a studio apartment, she wanted a bigger apartment. She was a model. And so she got a call at work one day saying, after work, if you'll stop, and it was in Manhattan, and like many Manhattan apartment buildings, in the basement there was a restaurant bar. She said, if you stop in on your way home from work, he said, I can work out you getting a larger apartment. He hit on her again. She said no. She got up and walked out, and he had hired 2 thugs to actually slash her face, which they did, to scar her so she couldn't work. And I said, because I had spoken to her before, I said, what did your girlfriend say? What did your mother say? And the response was, they asked me why I was in the bar. What in the hell does that have to do with anything? What is wrong when today young women who are victimized are asked the question, what did you say? What were you wearing? Why were you there? So we had to make sure, and it's still a crusade of mine and yours, to make sure that women who are abused never, 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 never ask themselves the rhetorical question, what did I do? For no man has a right under any circumstance other than self-defense to raise his hand to a woman. Period. Period. That's what we started. We made some great progress. We saved a lot of lives. Yearly domestic violence rates since the Violence Against Women Act passed dropped 64% in 20 years. Considerably more women are reporting because they know they will not be judged. We've saved billions of dollars in averted social costs, medical costs, loss of productivity. We now have a special victims unit in most police departments. We have domestic violence hotline that's been used by 3.4 million women and men. But when I asked my staff, the president asked me when I became vice president, what did I want to retain control over? I said one thing, I want to bring into my office the Violence Against Women office, which I created. It's ordinarily the Justice Department. We have two great attorney generals who were happy to let me run those offices. And so I asked my staff several years ago, I said, go back and look at the Bureau of Statistics, crime statistics at the Justice Department. And Debbie, here's what they found out. All these great things happened except one thing. For women between the ages of 18 and 24, nothing had changed. The incidents of rape and assault were the same as they were 20 years ago when I passed the law. As a matter of fact, women 14 to 18 in high schools were as many times victims of date rape and abuse as occurred when I wrote this legislation 20 years ago. I can't tell you how disappointed I was. I felt, my God, I would have thought that all of it would pass down, that young women would have been told by their mothers and their fathers that it's never their fault, it's never their responsibility, it's the responsibility, and taught their sons. So I told the president I was going to set up a White House task force to focus on this age group of 14, including high school, to 24 through college. And we asked, I was on telephone conferences with thousands of high school students and college students. Some of you may have been on some of those conferences with me. And we asked, my staff asked, what ideas do you have? And we got ideas in everything from better lighting on campus to being able to have more social contact with friends you could contact immediately, so if you were in trouble, etc. But you know what? The one thing that came through the clearest, whether it was a freshman in high school or someone in graduate school, he said, we got to get men involved. We got to get men involved. So that's why the president and I launched It's on Us 1 year ago, 2 days from now. Because you guys out there, it's on you. And that's no malarkey. This is not a trite assertion. There's a ritual every year here in Columbus and across the country when proud moms and dads drive up to campus with their bright, beautiful, generous daughters and drop them off and carry their bags up to their dorm. And to kiss them goodbye with great hope and expectation. But go home and ask your parents what one nagging thought they had as they drop you off. Is she going to be safe? Is she going to be okay? I know I've felt it when I dropped my daughter off. This should be the safest environment for any woman in the world. On the campus of a great university with enlightened people. But your parents, whether they know the statistics or not, they know what their gut tells them. They don't want their daughter to become one of those statistics. They may not know the exact number. The studies that show 1 in 5 women will be victimized, a victim of sexual assault or attempted sexual assault on college campuses. When I first came out with that statistic, the mainstream press challenged me. Biden's making it up. Nobody challenges anymore because it's a fact. Up to 90%, and many of you standing before me, and those who are in the weight room, I understand there's a lot of people in the overflow room. I'm sorry, I'll come in to see you if you have time. Over 90% of you know your attacker, whether it was an acquaintance, a friend, an ex-partner. And you know what all the psychologists and psychiatrists, and ask your psychology and psychiatry professors here on this campus in this medical school. Check my assertions. Don't take it on my word. You know, a woman who was victimized walking down the street, someone jumping out of an alley and raping her, the chances of that woman recovering psychologically are significantly higher than the woman raped by someone she knows. Because you ask yourself, why didn't I know? How could I have misjudged him? How could I have not known this? What was it? What was it? And this is an issue, as has been pointed out, for lesbians, gays, bisexual, transgender students as well. Josh talked about it. But every one of the survivors you know is not a statistic. It's your sister. It's your neighbor. It's your friend. It's a classmate you asked to borrow your notes from. That's why it's so important with Blair and Christine to speak out today. And it's hard, by the way. Those of you who've been victimized and not said anything about it, you know how hard it is. Because every time you speak out, you relive it as if it was yesterday. And you open yourself to that portion, smaller and smaller, of the population that blames you, that wonders whether or not you've told the truth, that wonders whether or not in the he said, she said, that you really, quote, asked for it. It takes incredible courage to share your stories. You know, but it is the most heinous crime that can be committed. But it matters. It matters they speak up. As I said, over the hundreds of hours of hearings I had.
And I do hate to interrupt
Survivors like Blair,
Joe Biden.
Kristen, who came forward and forced the country to look at this dirty little secret.
Yeah, could you roll on Biden? Yeah. And roll. You might want to roll on him too. I'm going to go ahead and interrupt Joe. We are recording this so we can bring it to you at a later time, but we do see that Donald Trump is about to take the stage, and I believe I heard that this was in New Hampshire, but I'll confirm.
We sat across the table with Donald Trump, and he wanted to know the real issues here in New Hampshire. Now, Donald Trump, if you look at his history, he don't talk about what he does too much for veterans. If you look at what he's done in New York for the veteran community on donating money to help veterans, not even a politician, he didn't have to kiss nobody's butt. He did it because he wanted to. I heard Donald Trump talk about ISIS. This is one of the things that motivated me. I've been to many of these countries. Whether you like it or not, these people want to kill us. And Donald Trump has the right idea that they have to be stopped. It's a shame we don't even know who our neighbors are anymore. We have to worry. Did you know I co-sponsored here in New Hampshire, Stand Your Ground? Because I want every American from New Hampshire have the right to protect themselves. Donald Trump believes in the Second Amendment. I just didn't take this, look at Donald and say, he's running his mouth, he's just like me. He's not politically correct. I dissected every one of them on who's giving me the BS and who's telling me like it is. Donald Trump looked me in the eye and he said, Al, I would never turn my back on veterans. So that's why I damn well sure will not turn my back on Donald Trump and have endorsed them. God bless America. Thank you.
Yeah, that puts the fire in your belly right there. All right, we have one more person before Mr. Trump comes in. You know, the thing is that the quality of the candidate can be seen by the quality of the people who support that candidate. And all the people who've come up here and spoken to you are some of the finest New Hampshire people we can offer. They fight every single day, whether it's their time in the military or whether it's time in serving in the House or the Senate. This next person did all that for us and was one of the first people to join Mr. Trump. Time and time again, when the budget wasn't being settled in New Hampshire, this man stepped forward and helped get it in the right place. It's a large part of why New Hampshire isn't in debt like other states and isn't in debt like our nation at $220 trillion. He served in the New Hampshire House, and now he serves as Mr. Trump's co-chair. Ladies and gentlemen, nice round of applause for Stephen, the Honorable Stephen Stepanek.
Thank you. So, how excited are you about Donald Trump for president? How excited are you that he is #1 in the polls in the nation and #1 at 40% here in New Hampshire? Back in March, I had the distinct honor of hosting Mr. Trump at my home. The last time I introduced Donald Trump, I spoke about his many achievements as a successful businessman. Tonight, I am going to talk to you about why I am wholeheartedly supporting Mr. Trump in his run for the White House in 2016. When President Bush left office in 2008, he set the stage for one of the worst presidents in our history. Over the last 6 years, Obama and his administration, including Hillary Clinton, have eroded the bedrock of what has made this country great. We are now at a crossroads. We are no longer the greatest country in the world. We are no longer a global leader. And for the first time in history, we are going to leave our children and grandchildren not with a nation that is better than what was left us, but with a nation that is broken and badly in need of repair. This may be our last opportunity to reclaim what we once had. We need someone who knows how to get things done, not someone who is simply going to orderly manage our decline. We need a leader, not a politician. We need to make America great again. We need Donald Trump. What sets Donald Trump apart from everyone else? First of all, he is not a politician. He actually made a career out of building infrastructures, creating jobs, unlike politicians who simply talk about creating jobs. Secondly, he can and is self-funding his campaign, which means that with Trump in the White House, the power of the presidency cannot be bought by special interest groups. The only special interest group that will have any influence over Donald Trump will be you, the people. Third, like Ronald Reagan, Donald Trump excels at identifying a problem and then surrounding himself with the most competent people to solve that problem. Unlike our current president, if someone doesn't do the job, Donald Trump knows how to say, "You're fired." In short, he will hold people accountable, which no one in Washington is doing now. For these and many other reasons, I am supporting Donald Trump for president. He is the most qualified candidate to reverse the decline of our great nation, and by far the most qualified person to make America great again. I have had the opportunity to personally meet all of the Republican candidates running for president, first at the Freedom Summit in Iowa, and then again at the Freedom Summit in South Carolina in April. What I got out of all those meetings was we have a group of individuals, although all good people, people who make the same political promises that they know they cannot keep. This great nation is in decline. Republican politicians have become experts at managing that decline. Democrat politicians have become expert at accelerating that decline. After reviewing the entire field of candidates, there is only one person who has shown the will and is capable of reversing that decline, and that is Donald Trump. Donald Trump cannot do this alone. He needs each and every one of you to help him make America great. Donald Trump needs all of you, if you have not already, to fill out an endorsement card. The establishment does not take Donald Trump or his supporters seriously. We need to show them tens of thousands of New Hampshire supporters are out there fighting for Donald Trump. We need to let the establishment know that we're damned upset about the state of our country. The silent majority is silent no more. Even though the University of New Hampshire's politically correct committee said we can no longer use the word American, I am here to tell you that I am proud to call myself an American. I am proud to support Donald Trump for President of the United States, the one person who can make this country great again. Thank you all for coming, and thank you all for supporting Donald Trump.
Looks like there's a bit of a pause in the event. They are playing some music. I'm not familiar with it, but I am going to go ahead and lower the volume a bit in case there are any copyright issues. If you are a regular viewer of Fox 10 News Now, you can watch us Monday through Friday, 10 a.m. to 9 p.m. this is kind of a regular thing we do, where if we have top 40 music, we have to lower the volume so that we can keep these videos up on YouTube for you forever. We are bringing you this live stream out of New Hampshire, and we're currently waiting for Donald Trump to take the stage. Probably his, I would say, very likely his first big speech since the debate last night. So he'll probably have a few reactions and zingers to last night's theatrical performances. Jeb Bush took a lot of swings at him, as well as Ben Carson, Carly Fiorina, so I'm sure we can expect him to come out swinging in regards to last night's debate.
Ladies and gentlemen, welcome to the Rochester Recreation Center. This evening's event is the largest political event in Stratford County history. Thank you for your participation. And now, let's make America great again and welcome the next President of the United States, Mr. Donald J. Trump. We love New Hampshire. Thank you, everybody. What a great welcome. Sit down, relax. We'll be here for a while. You know, I said today that we just got back, as you know, we came from Mobile, Alabama 2 weeks ago. We had 31,000 people. 31,000! Then we just left Dallas, where we were in the great Mavericks, as you know, the Mavericks building, the basketball team, a great team, a wonderful team. And Mark Cuban was so nice. He called, we know Mark, right? Good guy. And what happened is he said, what about using the arena? I said, well, how much do we have? How long do we have? And how many seats? It's 20,000 seats. They filled it up in 2 days. Is that good? I then flew from Dallas, always making speeches. I then flew, because we have to make our country great again, right? I then flew, and this was sort of fun, we flew to a very nice place, Los Angeles, right? And we went to the USS Iowa, and we were honored by a great vets group, which gave me an endorsement. They endorsed me. The vets liked me, and I love the vets. We have a lot of vets here tonight. We have a lot of vets, but the vets on the USS Iowa, that is some ship, by the way. They don't build them like that anymore. but they endorsed me. And then I flew, as you know, last night. We had a little thing called a debate at the Reagan Library. And it was sort of an amazing thing. We had an incredible time. Thank you. Thank you. That was some evening. Now, I'll tell you the problem with evening. It did so well that CNN said, let's make it an hour longer. Can you believe this? That debate was 3 hours. It felt like more than that. Now, why did they do that? For the young children here, because we have to teach them to be entrepreneurs. They did it because they wanted more revenue coming from the commercials, right? Isn't that terrible? Terrible. I think it's terrible. And the money should have gone to the vets, right? Right? The money should have gone. They made a lot of money. They made a lot of money. But in the end, it was an incredible time, and we had an incredible time. And I got such great remarks. Look at this. We just wrote this down. Time magazine, they did votes as to who won the debate last night, right? So Time magazine, 114,000 votes as of 6 p.m. Trump, 56. Carly Fiorina, 19. Rubio, 7. Ben Carson, 4. The rest not doing too good. Then, Drudge. We love Drudge. We love Drudge. Donald Trump, 51%. We had a total of 668,000 votes cast. Trump, 668,000. Think of it, 51%. Second, Fiorina, much less, like much. Then Rubio, then Cruz, then, I'm not going to mention the next name because I don't like him very much. Then Newsmax, way up ahead. Newsmax, you like Newsmax. I like it too. The great Chris Ruddy, I like it too. Donald Trump, first place by a lot. The Street, Donald Trump, 52%. That's a lot when you have all of these guys. That's a lot. You know, it's not against two people. It's against Donald Trump, 52%, first place. Then you had Slate, and that's also Donald Trump. So we had a great time. Now, you don't read about that so much on television because coming out, boy, Fox treated me shabbily. They treated me shabbily. But that's okay. CNN, a little bit better. They treated me a little bit better. But the end result is people know what happened. It was an incredible time. And we are going to do something very special. There's a great movement going on, and it's a special movement. It's a movement where people want to see our country be great again. They want to see things happen. They want to see the right things happen. They want everybody to get together, work. You know, the people of New Hampshire, you love to work, don't you? Don't you love to work? Huh? And, you know, so I had a little news yesterday because he's a great person and he's a great winner. I love winners. We love winners, right? So a great winner, Tom Brady. Tom Brady, right? So Tom is this incredible guy, total champion, and didn't even want to tell me about it. He endorsed me yesterday, right? Everybody up here knows that. That's good. When you get Tom, you're getting a champ, and he's a great champ. And we have some others, I won't mention them now, but I want to tell you, we have so many people that are endorsing, and so many really, you know, it's very interesting. Coach Ditka in Chicago, and people that I don't even know are just coming out in favor of Trump because they want to see the right thing happen. When CNN did its poll recently, they had a couple of different categories. One was leadership. In leadership, I win like forget it. Not even a contest. So much higher than everybody else, like 2 or 3, I don't know. You got all these cameras going, they can tell you. But leadership, way through. The other one is a little thing called the economy and jobs. Nobody close. The only thing they didn't love was my personality. Can you believe it? And I actually, no, it's the only thing. So here's what happened. So we went to Dallas, we went to Mobile, Alabama, we went to the USS Iowa, making speeches all over the place. Then we had the debate last night, which was exciting. And I said, you know what we're going to do tonight? No speech. Let's do question and answer. Do you want? So I want to just say, I'm going to say a few words, and then we're going to do question and answer. And you can make them vicious, violent, horrible questions, even though you're sort of probably on live television. How many cameras are lit? Yeah, there's a lot of them. Every time I speak now, it's on live television. You know why? It's a very simple business, ratings. If I didn't get ratings, those cameras would not be on, okay? They would not be on. So when you ask your question, remember you're on live television. So here's what we're going to do. We're going to talk for just a couple of minutes, military. We're going to make it so strong, so great, so powerful. And I always say, we'll probably never have to use it. Who wants to use it? We've got to have it. Because right now, what's happening in the world, we need that military, we need that protection, and we're going to have it if Trump is elected president. That I can tell you. That I can tell you. As part of that, because I consider it part, but as part of that, we're taking care of our vets, okay? And the vets are going to be so happy. But they love me anyway. I don't have to do this. I'm just telling you. And I've been up here many times. Where's my man? Stand up. Have I been up here many times? With my guy. And we're going to take care of things. And so many vets in New Hampshire. And they're not treated right. They're not treated right. But they're not treated right anywhere. You know, 2 weeks ago on Wednesday, they had the longest wait in a waiting room that anybody can remember. Okay, think of it. The longest wait, where they'd wait 3 days, 4 days, 5 days. Not going to happen anymore, folks. Not going to happen anymore. Not going to happen. And we're going to come out with a plan, but one of the things we're going to do, when you're going to have to wait that kind of time, you're going to go to private practice, you're going to go to private hospitals, you're going to go to, even if it's public, we'll take care of costs. And believe me, it'll be less expensive and you'll get much better service. But you're not going to be waiting in rooms for 5 and 6 and 7 days to take care of a condition that can be done immediately. It's not going to happen. It's not going to happen. The other thing I want to just dwell on for 2 seconds, and you've heard, but we are going to build a wall at the border. We're going to build a wall. And people are going to come into this country, but they're going to come in legally. They're going to be legal. They're going to come in legally into our country. So when I announced, as you know, a couple of months ago, I've been a politician for almost 3 months. Can you believe this? I never thought in a million years I'd be a politician. I know. That's the hard part. That's true. But we're running this time, and this time's going to be incredible. And by the way, you look not just at the New Hampshire poll that I told you about, 40%, but you look at all the polls. It's absolutely incredible what we're doing, and what we're doing really together. So immigration, and I've been saying it, and the politicians all talk, no action, although we have a lot of how many politicians are in this room? Raise your hand, because these guys are great, fabulous people. These are fabulous people right here. Stand up. It's my guy. He's been with me from the beginning, right? So what? Okay, how about elected officials? How many elected officials? Stand up. All right, these are all fabulous people, especially you. So we are going to do something, and when the wall gets built, I've been saying Mexico is going to pay for it. Now, I love Mexico, and I love the Mexican people. I do business with Mexico. I do business with Mexican people and entrepreneurs. I have many, many people from Hispanics working for me. Many, many, many Hispanics. But you know what? The problem is, whether it's China or Japan or Mexico, they're outsmarting our leaders. And we're not going to let it happen anymore. We're not going to let it happen. Okay? We're not going to let it happen. I asked about a week ago, I said, I want to know, what is the trade deficit? United States trade deficit. What is it with China? It's almost $400 billion a year. We're talking about a year. In other words, we're losing almost $400 billion. That's only China. In Japan, it's about close to $75 billion every year. And it's been pretty steady. It's going up, of course, because, of course, why wouldn't it? They get smarter, we get dumber. So it's getting worse. So then we get to Mexico. And you know, with Mexico, it's about $45 billion. Could even be now more than that. So everybody says, and I've watched these politicians. I see even the people I'm competing against, the so-called candidates. You saw them last night. Some are very nice, by the way. But you look at it and you say, and they say to me, you can't really do that. Why would Mexico pay? They won't pay. They'll never pay. Then I say, why wouldn't they pay? They owe us, and just think of it. We send hundreds and hundreds of millions of dollars into Mexico. You have a huge problem at the border where the cartels, the drug cartels, pour in with drugs, pour out with money. So they come in, not a good deal. We're not making a good deal there. But they are coming in with hundreds of, you have to see this, the numbers. They're staggering. Get shipped all over the United States. And then people say, oh, the wall doesn't work. You ask Israel whether or not a wall works. Believe me, a wall properly done, a Trump wall works. That I can tell you. That I can tell you. But, you know, these guys, the politicians, and they're politicians, so I understand. I understand where they come from. My whole life I've dealt with politicians. They'll say, you can't get Mexico to pay for the wall. It'll never work. And I say, why? Well, it just doesn't work. Why would they do that? I say, why would they do it? Because we're losing almost $50 billion. Think of it. $50 billion a year on trade. Why wouldn't they do it? It's peanuts. You know, they say it's going to cost 10 or 12. But that's for people that never built anything. These are people that have no idea. You'll do it for much less. The difference is it'll be bigger and better and stronger. And people aren't going to Home Depot and buying a ladder and walking right off. Not this wall. Not this wall. And by the way, this wall is going to have a big, beautiful open gate. We're going to have a nice opening. And when people want to come into this country legally and they want to go through the process, and it's going to, we all welcome them. Is that a correct statement? I mean, we welcome. And when someone goes to Harvard and they're number one in their class, or Stanford, or the Wharton School of Finance, or Yale, or any of them, and they do great, and then we throw them right out, and they go back to a country, and they try and compete, and they do very successfully. We want to keep those people. We want to keep people of talent. We want people of great talent. So we've got a plan in terms of illegal immigration. And remember this, when I first announced, and this was an incredible 2 weeks, believe me, Rush Limbaugh said, I have never seen anybody receive more incoming, a word I never heard before. Incoming means really bad press. I mean, it was incoming. But he said, I've never seen anything like it. And then he doubled down. I doubled down, and it's true. And he said, nobody would have done that, because I knew the problem. I knew what was happening. And we have tremendous crime, whether it's Kate in San Francisco, whether it's Jamil in Los Angeles, whether it's the woman 2 weeks ago who was killed in California, a 66-year-old veteran who was raped and sodomized and killed, unbelievable, by an illegal immigrant. And it's just not going to happen anymore, folks. You know, it's not going to happen anymore. We're going to have a border. And we're going to get the gang members out of here fast. You know, you got a lot of gang members that are illegal immigrants. You go to Chicago and different places. You got a lot of these are tough dudes. We're going to get them out of here so fast your head will spin, all right? Your head will spin. So I'm really honored by the crowd, and we're going to have some fun now, because instead of making a speech, which I've been doing over and over and over, I want to take questions. Don't we like that, right? Okay. All right, let's start with this group right over here. Come on. Okay, this man, I like this guy.
From White Plains. Amen. Okay. We have a problem in this country. It's called Muslims. We know our current president is one.
Right.
You know he's not even an American.
We need this
Birth
question.
certificates,
This is the
man.
first question.
But anyway, we have training camps growing where they want to kill us.
Mm-hmm.
That's my question. When can we get rid of
We're going to be looking at a lot of different things. And, you know, a lot of people are saying that, and a lot of people are saying that bad things are happening out there. We're going to be looking at that and plenty of other things. Okay, go ahead. Yes, ma'am. Go ahead. Go ahead.
You know, I definitely got to ask you a good veteran question. Welcome, first of all, to New Hampshire. Donald, last night was a disgrace. CNN did not touch on any of the issues that are going on with veterans' health care.
It's true.
Women veterans'
That's
health
true.
care.
I actually asked him about that. There wasn't one question relating to the veterans. That's true.
Did anyone even ask them why? I know that's a Clinton News Network. Is it that they don't like veterans, or?
You know what? There was not one question relating to that, and not too much on the military, by the way, but nothing relating to the veterans. Those days, believe me, are over. Okay. Yes, ma'am. Go ahead. Go ahead.
Hi, Mr. Trump. Thanks for
Hi.
being here. The economy and job market is a big issue. I just finished my master's degree, and now during my job search, I'm told I'm either overly or underly qualified. I believe the unemployment rate is skewed. What can you do to improve the job market for people like me, qualified, talented, educated U.S. citizens?
You know, it's such a question. I get it all the time. It's an amazing question. One of the things we're doing, we'll be taking our jobs back from China and Japan and all of these other places that have been ripping us for years. I've been talking about this for 10 years, 15 years. No politician sees it. We're bringing our jobs back here. We're bringing our manufacturing back here. One of the things, and I will tell you, it's probably maybe the question, other than the vets, maybe it's the question I get asked the most, okay? And that's people, young, beautiful, great people, they go to college, in many cases borrow a lot of money to get through college. They're so proud of themselves. They do well. They're good students. They work hard. They get out. They can't get a job. With Trump, you know, there's an expression, I will be the greatest jobs president that God ever created. I tell you that. That's what you need. Okay.
Can you hire me, please?
Go ahead. Go ahead. Go ahead. Then we're going to go right around here. We'll go around. Don't worry about it. A lot of people with hands up. Okay, let's go.
Mr. Trump, I was wondering when we can get together and work on the unsafe conditions at the Seabrook plant. It's been a month since I gave you that information.
I remember that. I remember you gave it.
And I think you and I should have a press conference because both governors in Massachusetts and New Hampshire aren't protecting the first responders. And I would like to work with you on it.
Okay, we'll take a look at it. We're going to look at it. Go ahead. Next, back here. Go ahead.
So when it comes to paying off debt, the United States doesn't have that good of a record there.
Go ahead.
So I have a question about the Trump wall.
Right, Trump wall.
When it comes to paying off debt.
Trump wall? He goes, see, that's what's going to happen.
Hey.
That's why I'm going to make this wall so beautiful, because when I'm gone, they're going to probably change the name to the Trump wall. I've got to make it beautiful. I've got to make it big, big and powerful and beautiful. Go ahead, Toby.
Okay,
Tell me, and
okay,
by the
so
way, he
on
said
that
Trump
point-
wall, I didn't.
On
Go
that
ahead.
point, so the United States, we don't have such a good record when it comes to paying off debt, right? We all know.
Not such a good one. No, we owe 19 trillion. I would say we're not doing too well.
Exactly. So how is it that we're going to expect Mexico to repay their debt? by
Because they
building
make
wall?
a fortune off us. They make a fortune. They make so much money. They're taking our business. You know, Nabisco
We
is
also
now
borrow a
moving.
lot
Wait a
and we don't
minute.
pay it
Wait.
off.
Do you like Oreos? The cookies, right? I'm not eating Oreos anymore. Nabisco is closing their plant, a big plant in Chicago, and they're moving it to Mexico. Ford is building a $2.5 billion plant in Mexico. Mexico's doing very well. We love Mexico, but they're doing very well. We need leaders that can deal with them and deal with all the other countries, and not just the three I named. We need leaders that are smart and tough and cunning. You know, I have Carl Icahn lined up. I have some of the greatest business leaders in the country lined up. Really tough, smart people. And they're going to help us, and they're going to go and negotiate, and we're going to make great deals, and we're going to bring jobs back so that you can get a job. Okay? You like that? Okay. Come on over here. Question. Yes, sir. Go ahead with the hat.
Welcome back to New Hampshire.
Thank you. You think it's hot enough in this place? Man. This, you know, last night was pretty hot. This blows it away. Go ahead.
I applaud the gentleman who brought up the Muslim training camps here in the USA. The FBI knows all about that.
Right.
But America has also guns pointed at ordinary citizens here. One of the.
Don't get nervous. You're in about 7 television networks. Don't get nervous.
One of the bureaus is the
Don't choke.
Bureau of Land Management.
Go ahead.
in the agriculture. Now they're going into different ranches, shutting them down.
Right, that's right.
Overregulation, but they seem to be pointing a gun to make sure they get their fees. This is our own government putting us at siege. How can we get in there and stop this?
Well, so many things are going to change. You know, these are regulations, and but so many things. That's one. You know, one of the things, being in real estate, we have Army bases, Navy bases. So many are for sale. And so many have been sold over the last short period of time. And you say, how many can we sell? I see it all the time. They come across my desk. So many. Things are going to change. Okay, go ahead. You had a question over there? Go ahead. Go ahead, you. Young, handsome guy. Go ahead.
This gentleman, Daniel Tabus, was a friend
Daniel
of mine.
Tabus was a great man.
He's also
My friend. He was my friend. He passed away. He was my friend.
He's one of America's rags to riches stories.
It's true.
I think that America's kind of lost that American dream. What can Donald Trump do to bring that back?
So Dan Tabus is from Philadelphia, became a big banker, but a really good banker, a real banker. And he was a friend of mine. He passed away a few years ago, and he was a very, very successful guy and a great guy, and you're right about it. Look, we will bring the American dream back, that I can tell you. We're bringing it back, okay? And I understand what you're saying. And I get that. I get that from so many people. Is the American dream dead? They're asking me the question, is the American dream dead? And the American dream is in trouble, that I can tell you, okay? He said it's on life support. It's in trouble. But we're going to get it back, and we're going to do the real job. How about the man with that beautiful red hat? Stand up. Stand up. What a hat. What does that say on it? Wow. Make America great again. That's beautiful. Beautiful.
Mr. Trump, can you please explain your position on the Second Amendment?
Want to say what?
On the Second Amendment?
Second Amendment, all for it. You need the protection. You know, we had a incident in New York, which was very interesting. The two prisoners 6 months ago, 7 months ago, that escaped from a maximum security prison, a real beauty in New York, they escaped. And they went up, and people were really scared. These were killers and tough cookies. And a man and a wife were in the home, and the wife was totally anti-gun. She hated that the husband had guns. And the guy was pro. He was a big Second Amendment guy. He was pro. And all of a sudden, they're waiting, and these two tough cookies, tough guys, bad guys, are somewhere around their home within a little bit. And she all of a sudden now is totally pro because she felt she was so happy that her husband had guns. And they had the gun on the table and the gun they were carrying. And you know what? They never had to use it. They never had to use it. Because remember, only the bad guys use it. But they were secure. And now she's bigger than the husband in terms of wanting that. So I think that's pretty much what you want to hear. No, 100% pro Second Amendment. Yes, sir. Go ahead. Go ahead.
Mr. Trump, I'm a veteran of both Iraq and Afghanistan, and I've seen...
Good. Wow. Good shape.
Thanks.
Were you hurt at all? Were you wounded ever? Were you ever wounded? You look good.
An IED blast and a couple ground incidents.
Well, you look great. Go ahead.
Thank you. I've seen a lot of human suffering, both on the Iraqi side and the Afghani side. What, if anything, should the U.S. be doing for the humanitarian crisis that's happening in Syria right now?
Well, look, you have a crisis that's massive. And I'm getting that question a lot as of about 2 weeks ago, where you have hundreds of thousands of people. But you know, there comes a point, and we all have to have heart, and I think I have as big a heart as anybody, but there comes a point where this country has to say we have to get our own act together. We have to do it. The other thing is, when you're looking at ISIS and all of the problems that are being caused over there, you say to yourself, well, what happens if a lot of these people are Al-Qaeda, ISIS? You know, you could have 15 different things occurring. You don't know. They don't know anything about them. Now, with all of that being said, Europe, they got to help themselves. Every once in a while, they're going to have to help. Can't always be the United States. We have our bridges, our roads, our tunnels. We have problems here. We owe So much money. You know, we owe Japan $1.4 trillion. Think of it. They sell cars by the thousands. They come off, I saw boats 2 weeks ago in Los Angeles. Thousands of cars all over the place. We owe them money. How do you do that? They're selling to us. We owe them money. Very simple. We have people that aren't very smart. China, we owe them the same amount of money, 1.4. Now it's up, $1.4 trillion. We got to straighten out our own country. With that being said, you have the Gulf states, very rich, Saudi Arabia, Qatar, Bahrain. They take nobody. They don't want to have anybody, okay? They don't want to have anybody, all right? Nobody. You have Europe. You have all these places. They got to help. Now, what I do like is a safe zone. You know, you get a lot of sand in Syria, right? I do like the concept of a safe zone where you put them there, you build it out, you have security, you create a little bit of an environment maybe until they can ultimately go back to their homes, which most of them really want to do. They're great people. I mean, they're caught in this horrible conflict. But the concept of safe zone is something that really makes sense. Probably they even like it better. They stay, and we help them. And we help, but we have to help Europe. And the Gulf states have to contribute. You know, Saudi Arabia before the oil price, but, you know, in all fairness, so now it's a little bit less. Saudi Arabia was making so much money beyond anything and beyond anybody's comprehension. All of these countries have to get together and they have to fund it. We can do something, but we have to get other people to help us. We can't be the patsy every time there's a problem, and in the meantime, our airports are third world. Our bridges are falling down. You see the safety record on our bridges, like 62% are in danger. Our roads are collapsing all over the country. We are a mess. So we want to build our country, and we want to help people on a humanitarian basis, but we have to do some things to help ourselves. I mean, it's time maybe for us to help ourselves. Okay, in the back, go ahead, in the back. Let's go. Then I'm going to these people that have the lousy seat. They're looking at the back of my head. But they see that it's real. That's okay.
Hello, Mr. Trump.
Okay, go ahead. Give me a question.
Do you plan to visit with the Pope when he comes into Philadelphia?
Well, the Pope believes in global warming. You do know that, right? Hey, in this room, it's so hot in here, maybe I'll start to believe it myself. This room is hot. This room was not designed, the air conditioning was not designed for this many people. No, I like the Pope. A lot of personality. Good man. Good man. Yes, ma'am. Go ahead. Go ahead. Okay.
My name is Helena Sorensen, and I have a house here in Hampton.
Good.
I've worked very hard all my life.
Good.
My parents came over during the Berlin airlift in March of 1950. When they landed, they both had to work in the mills. My father became a carpenter, put us through school, and here we are, working hard, getting Social Security, but my problem is that the people that are coming over here, they're landing on the shore, they have no problem going in, they get food stamps, they get housing, they get electric, they get all of this, and it's coming from our Social Security money.
I know.
And we're getting nothing, nothing.
She's getting more and more excited. Look at that.
And Carly Figuerina.
You're right.
Carly Figuerina, I watched her debate yesterday.
I tell people.
She put our company, Lucent Technology, in the ground.
Carly Fiorina.
We were forced to
Say it
retire.
again, because people might as well hear it. I mean, people have to learn. I thought I'd wait a couple of days before I expose her business failure. But honestly, it's so ridiculous. Go ahead, tell me.
Our stock, I invested in my stock. I worked for the company for 37 years.
And that was
I
Lucent.
Forced to retire.
Lucent.
Yes, Lucent.
And headed up by who?
Well, Carly.
That's right.
Okay,
That
Carly.
was before Hewlett-Packard.
Before Hewlett-Packard. Well, I was buying stock to put into my retirement at $87 a share. When I was forced to retire almost 15, 16 years ago, my stock wasn't worth 25 cents. I lost almost $500,000. That's what I planned on retiring, and I got nothing.
Yeah. Well, you know, the Carly thing is sort of amazing because a lot of people don't get it. Because Lucent was a disaster, you know.
Yes.
Lucent was a company that she ran prior to Hewlett-Packard. When she bought Compaq, she was heading up Hewlett-Packard for a while, a little while, very short while, and then made the decision to buy Compaq Computer, I guess. And people that worked there said that company was such a great company until she got involved and until she went out and she made this horrible acquisition. and it just has destroyed the company, Hewlett-Packard. In fact, yesterday on the front page of the Wall Street Journal, big story, main story, that Hewlett-Packard, that they're dropping about, 30,000 jobs now. They're still recovering. They may never, who knows if they're ever going to recover. But, and then everyone's saying she made a good speech yesterday. I don't know. I don't get it. I don't get it. I don't get it. But at some point, people are going to see, and I think it's going to be a very big roadblock, you know. Now, when you look at Trump, okay, Trump, I built an unbelievable company, tremendous net worth, which I don't want to talk about other than to say it's the kind of mentality you need in this country, at least for a period of time. At least. And you know, as a businessman, I helped Democrats, I helped Republicans, I helped whoever because I did everything. I used all of the laws of the land. I'd buy a company, I'd throw it into a chapter, I'd chapter it, you bankrupt it, you beat the hell out of the banks. That's like I was a businessman. I have to do that. And by the way, you have many people in my position where they do the same thing, but nobody talks about it. I mean, I'll give you a list of names. In fact, we're writing up the biggest business leaders in the country have all done the same thing, and nobody ever talks about it. But I've done great, and that's the kind of thinking you're going to have to need. And you know what? We'll make it rich again. We'll make it fantastic again. I'll leave, and then you know what's going to happen? Somebody else can blow it. But we have to save our country. So with Carly, she did a terrible job at Lucent. She did a terrible, terrible, terrible job at Hewlett-Packard. Terrible job. Stories have been written that are legendary. The head of the Yale Business School, Jeffrey Sonnenberg, you know who he is, right? Right? He wrote a story that was so brutal. And I mean, people are going to have to read this. They're going to have to read it. I just don't see how she can get over that hurdle. In addition to which, she cut thousands and thousands of jobs, and they're still cutting them. And bottom line, you know what? She made a horrible purchase because the compact purchase was a disaster. She made a horrible purchase. But a lot of people don't know, before Hewlett, you had Lucent. And Lucent probably was just as bad, if not worse, relatively. Okay, yes.
Hi, Mr. Trump. I have not a question, but I just want you to know about the nightmares that I have. ISIS beheading Rochester's young Foley. I'm having horrible visions of people I know and, you know, everyone being loaded up into boxcars, you know, like another Holocaust. I just want you to know about that. You're welcome.
Does anybody have a towel? You know, I've lost a lot of weight. The good thing is, running for president, believe it or not, every room we have is packed, and nobody has enough air conditioning because of that. And I'm losing a lot of weight, so it's not so bad. Go ahead.
Okay, here's the question. When will we meet your first lady?
That sounds good. Wow, that sounds so great. Thank you, darling. Okay, go ahead, wherever. Go ahead, right here.
My question is just simply, when you're talking about the deportation of our legal aliens here that are used to taking all the money out of coffers, why is it that you don't identify how much it costs to keep them versus how much it costs to send them back?
What a great, he's a businessman. Hey, he's from New Hampshire. What else is there? So it's such a good point. And I made it last night, but people don't want to hear it. They don't want to hear it. To keep, we spend really, I would say, $200 billion a year. Okay? $200 billion a year on illegal immigration. I think the number is much higher than that. To get the bad ones out, to do the wall is peanuts. By the way, peanuts. You know, I tell the story all the time. The Great Wall of China, 13,000 miles long. Against our southern border, it's 2,000, of which you really need 1,000, because you have a lot of natural barriers and a lot of other things, frankly. But you need 1,000. So they say, oh, you can't do it. And yet 2,000 years ago, they had no problem. 2,000 years ago. He brings up such a great point. We have a cost of, I believe it's in excess, and we have numbers that go from 175 billion a year to 250, 260. The fact is, nobody knows. Nobody even knows how many illegals we have here. Because, you know, we've been hearing for years, 11, 11, 11, never moves, right? It's always 11. Give me a break. So it might be much more than that. But we're a country of laws. We're a country of borders. We have to secure our border, and we're going to clean it up. We're going to make our country so strong and so wonderful and so great. Okay, okay. And you're right. You're right. There's a huge offsetting cost, which, by the way, which will really help out. Okay. What's your favorite? What's your favorite? 1 Timothy 3. Say it. 1 and 7. Okay, it is noble to see governors of overseer. However, he who does to be above reproach, sober-minded, unquarrelsome, only marry once, and not a great lover of honey. Oh, boy. Am I in trouble? Am I in trouble? Am I in trouble? Okay, go ahead. Yes. Yes, sir. Thank you, man. Thank you, thank you. Go ahead. Okay, thank you. Thank you, thank you. Go ahead, can you hear it? Yes, sir.
Okay, I'm sorry.
Go ahead.
Donald, my question is this. If you're elected president, one of the things that's been happening over the last several decades is our congressmen and our senators voting themselves huge pay raises and other benefits. If they are elected for one term, they get a lifetime pension, they get medical, they don't have to join Obamacare. If you're elected, sir.
In fact, they don't have to use Obamacare. Isn't that incredible?
That's correct. If you're elected, would you introduce a bill in both houses to roll back these benefits? The people that don't vote for it or voted fired election time.
What I'm going to do is tell not a big deal for me. The thing is, when these guys go for your question, when they go to Congress, a couple of things happen. First of all, they get benefits that nobody else can even think about, okay? And they don't like to talk about it. We'll work on that. We have bigger problems than that because that's peanuts in the relative scale of countries being hurt. But we're going to work on that very hard. But I will tell you this. Well, system that is going to be fair to everybody. One of the things I'm doing that has gotten a lot of praise, I'm self-funding. I'm not getting $10. And, you know, it's very unnatural. No, it's very unnatural for me. You know, and foolish. Because people come up, they want to give you lots of money. Lobbyists, special interests, donors, they want to, and I keep turning them down. I'm the only one, I believe, out of all the people running. Look, I talk about the hedge fund guys. They're going to have to pay. We're lowering taxes in this country for corporations, for the middle income. You're going to love me. We're lowering taxes. We're going out in 3 or 4 weeks with an amazing plan. But we're lowering taxes in the country. But the hedge fund guys and others, the hedge fund guys are going to have to pay up. They're going to be paying. And you know what? That's okay. Somebody said, that's not very Republican. I don't see anybody weeping in here. I don't see anybody weeping. You're going to be very, very happy when you see what we do with the taxes, when you see what you do with jobs, with economic development. You are going to be very, very happy. Go ahead.
Okay. Oh.
Yes.
Hi.
Hello.
Oh, hi. Thank you. Everybody.
Nervous. You're not getting nervous.
Nervous,
Okay.
but awesome questions. Very
and I love that. My question's a little closer to home.
Okay.
I just spent the last 2.5 years and $50,000 working to keep my daughter safe.
Wow.
So my question to you is, and the result could have been better, under your leadership and authority, do you think that's going to trickle down all the way to the state level and our court systems to help families like mine not have to endure what I went through?
Did you say safe, to keep them safe?
Safe.
What are you doing? What are you doing?
Well, it's over now, but it's over now.
Wow.
Family court system is broken. So my question is...
I see, yeah, it is. Very much so here. Yeah, I hear it is. The whole court system is broken, by the way.
Right.
Not just family court. You look at what happened with Justice Roberts, where he approved Obamacare twice. Okay? I mean, you're talking about more than local.
Right.
The answer is yes. I do think that should be a local situation. I'll give you an example. Jeb Bush loves Common Core. He loves me. No, think of it. I do like that being local. Local. From Iowa, I want to see local people taking care of your children's education and working instead of people from Washington that in many cases could not care less. So think of it. Jeb Bush, and just to use him as an example, there's other guys that are actually ahead of him in the polls by a lot. But Jeb Bush is totally in favor and strongly in favor of Common Core, right? And he's weak on immigration. How can you have him? You can't have him. You can't have him. So I don't think he's going to do too well in New Hampshire or Iowa or anywhere else. Okay, go ahead.
Mr. Trump.
Okay, go ahead. You go first.
How you doing, Mr. Trump? Thanks for coming. My question is, we all know the country is getting bigger and bigger. And our American manufacturing is getting sent overseas with all these horrible trade deals. How do you plan on bringing back American manufacturing jobs? And would you repeal NAFTA? How do you feel about the TPP deal?
Your new trade deal is a terrible deal. And one of the big things that really is hurting us is currency manipulation. It is a disaster, and that answers that question. That deal is not the deal that should be made. I've not been a fan of NAFTA. You know about NAFTA better than anybody because your places have been just stripped out of all of New England. And you know what's happened. They've gone to Mexico. They've gone all over the place. But I am not, and I have never been. We are going to bring our jobs back. We're going to have Ford going down to Mexico. Lots of other. We're going to have them build here. The incentive that they need to build here. Go ahead. Go ahead. Go ahead, darling.
Hi, Mr. Trump.
Hi.
I'm Megan. I'm a volunteer with the League of Conservation Voters, and
Good.
I'm here to ask you what your plan is to reduce pollution that is driving climate change and endangering public health.
That's an interesting question. Let me ask you a question. Okay. So we have to look at this. Okay. Take it easy, fellas. People out here believe in warming. Do you believe in warming? Who believes in global warming? In global warming. Who believes in global warming? Raise your hand. Wow. Not much, huh? Do you have your hand up? Little? No? No. Nobody? One person?
Well, sir, that's
Well,
because
it's
of
a
the
very
Trump
interesting.
rally.
You believe, right? You believe? Okay. Two more questions. Two more questions. Let's go. Go ahead. Right here. Right here.
Excuse me.
Go ahead.
Just last week, one of the other candidates said that he thought the BRAC, the base realignment and closure system, was good because it kept workers on their toes. Do you believe that the way to make people more efficient is to threaten to take away their jobs, our military, and those who support our military?
And you're saying that's what's happening, right? Yeah, no, I know that. I heard that. I heard that yesterday, actually. Not a good situation. Okay, question. One more. Make it a good one. Make it a good one. Go ahead, ma'am. Right here. Right here. You, go ahead. Go ahead. Give her the mic. Give her the mic. Go ahead. Make it a good one. Otherwise, we'll have to do one more.
Know what your plans are on Social Security.
We're going to save Social Security. We're going to save it. We're going to save Social Security. That was your deal, right? We are going to save Social Security. We are going to make that it's ever been in this country. We are going to build up the military. We're going to end, terminate, repeal Obamacare and replace it with something really, really great that works. That works. Ladies and gentlemen, thank you very much. It was great. Thank you. Thank you. Thank you. Thank you. Thank you.
And I do apologize for our technical difficulties. We're using satellites, and sometimes due to weather and unforeseen circumstances, our satellites and our satellite system is a little weak. Remember, we're out of Phoenix, Arizona, pulling these satellites from all over the country. So I do apologize for the temporarily weak signal. We've got additional coverage coming up for you out of Texas, and we will stay on Trump for as long as we have him. Typically, he talks to the media, but as you saw, he was very unhappy with the air conditioning situation in this video, so he might take a bit of a break to cool down. We're going to head on over to Hillary Clinton's event, already in progress.
Support this renewed spending.
The microphone, please, and then we'll kind of, I'll twirl around here. Yeah, gentleman with the beard, right there. Okay, microphone, right there. Okay.
Hey, I had a killer leading to this question, but my name is Mark Boyd. I'm a volunteer of. And my question, well, the question is, Social Security is and families like my family are desperately in need of the program. How would you ensure Social Security remains strong and your grandchildren?
Okay, so we got security. Let's see, where else here? What? Veterans, nuclear Big money in politics. Okay, yes?
I apologize for the technical difficulties. I'll have our feed back up as quickly as I possibly can.
Continued the process, rid the world of nuclear. A long way to go, and we're just going to have to, figure out how best to manage it. It's one of the reasons why I supported the Iran deal, because it put a lid on one more country getting a nuclear weapon, at least for a number of years. I have defended, and I will do everything necessary to defend Social Security. And the only point, the situation is not as dire as the Republicans paint it. So if we are really come to some agreements about what we need to do to extend the solvency beyond 2034, we can do that. I know we can do that, and I to work with anybody who will let me do it.
I'm going to go ahead and cut out of Hillary Clinton for right now.
And I will not
look at some other headlines while we try to stabilize our satellites.
Able to deal with their living expenses under Social Security, and those are single, widowed, and divorced women who are the recipients in Social Security. So I want to make sure we defend it. We will never let it be privatized. That is absolutely off the table, and you can count on me.
Let's check out what Josh Earnest recently had to say in regards to China relations.
Despite what some of the other people on the stage last night were saying. Yes?
Essentially, these individuals would have their access to the U.S. financial system either severely limited or entirely shut off.
But for now, the Obama administration is choosing not to hit the Chinese with major sanctions. That decision to delay comes amid growing concerns about deteriorating U.S.-Chinese relations. Sensing urgency in the matter, China over the weekend sent security official Meng Jiangshu to meet with National Security Advisor Susan Rice. Additionally, a Chinese delegation met with FBI Director James Comey, as well as representatives from the Justice, State, and Treasury departments. China, however, insists it's the victim of cyber spying, not a perpetrator. But experts say that's not the whole story.
Yes, we spy on the Chinese government, but there are two things that China does that are beyond the pale. First of all, they spy on U.S. companies to obtain information to help their companies better compete in China and in global markets.
Chang says the Chinese also spy on institutions of freedom like the press, even religious groups.
We've made very clear to the Chinese that there are certain practices that they're engaging in that we know are emanating from China and are not acceptable.
Not acceptable, but also unlikely to end anytime soon without a strong response from the White House.
The only way that we are going to get the Chinese to stop unacceptable conduct is to impose costs that are greater than the benefits they receive. And until we do that, we are going to be subject to malicious cyber attacks that, as the president said, are a core matter of national security.
Much to the surprise of many, it wasn't until this evening that the White House officially announced President Xi's visit here to Washington. It'll happen next Friday, the 25th, and the two men should certainly have plenty to talk about. At the White House, Kevin Cork, Fox News.
Instances, people that worked for me just the other day, 2 years old, 2.5 years old, a child, a beautiful child, went to have the vaccine and came back and a week later got a tremendous fever, got very, very sick, now is autistic. I only say it's not, I'm in favor of it.
I think it's masterful. Our colleagues, to one degree or another,
agreed with that. So today we will go to the floor, have a strong vote. I'm very proud of the debate and the substance on which our colleagues have based their decision and made their statements. It is also interesting to note that today in the Washington Post there's an op-ed, or I don't know if you call it an op-ed if it's not on the op-ed page, but an op-ed by President Hollande of France, Chancellor Merkel of Germany, and Prime Minister Cameron of the UK, in no uncertain terms, saying how important this agreement is, and it just shows what diplomacy can accomplish. So this is a day not only of making history by supporting the agreement, but making progress by having the agreement move closer to fruition. I would be pleased to answer any questions you have.
Looking ahead to the CR.
Oh, excuse me, just 1 second. I'm happy to talk about that. Any questions on what's happening today, or is all the mystery gone? Usually you'd be asking now, how many votes do I think I will have?
Why do you, how do you account for the just sort of like the stark black and white nature of the business in which every Republican is speaking in apocalyptic terms, and most Democrats are speaking in favor of the agreement, and there doesn't seem to be a lot of nuance or a lot of
well, I think you see some of the nuance outside, not even nuance. You see association. We associate ourselves with statements of the nuclear physicist who said, congratulated the president and said that this was an innovative agreement, an agreement that would be, what's their exact word, a guidepost for future non-proliferation agreements. We associate ourselves with generals and admirals who have said, come out in support of this, of the heads of state of other countries and their diplomats who have said that we are going to hold, this is a good agreement, we're going to hold Iran accountable should they even entertain the notion of cheating, and that's in the three heads of state statement. We have ways to know in advance even of that. So it's not about what happens between Democrats and Republicans here. It's about the unity of Brent Scowcroft, of security advisor to President George Herbert Walker Bush, and other Republicans coming out strongly in support of this, and saying in his statement that Secretary Moniz is the foremost authority in the world on this subject of nuclear weapons and proliferation. It's about John Warner, former chair of the Senate Armed Services Committee, joining Carl Levin, another chair, in support of this agreement. Diplomats of Democrats, Republicans, no party, coming out in support of this. So your question should be to the Republicans. Why is it that not one Republican could examine the substance and come to a different conclusion? I think that's really the question. But you know what? We're all going to come together in support of our security, Israel's security, and making sure that, and rather than engage in really, it's hard to describe what is happening before at the Republicans, in order to get a vote on the rule, they have this potpourri of votes there. But after that, hopefully a level of seriousness will set in on them to say, we have the agreement, let's make sure they honor it. Because if your concern is that they don't honor it and that's why you object to it, let's make sure they honor it. Then we're all on the same page. This is very exciting. This is a very exciting historic event. We have never had an agreement where we haven't had to give something up in terms of our own arsenal. Ronald Reagan. Our goal is to rid the world of weapons of mass destruction. Many other countries are supporting this because they know the danger of Iran having a weapon, not just because Iran would have it, which would be horrible of itself. They can't get it. But what it would cause in terms of contagion of other countries deciding they wanted a weapon as well. It would be over. It would be over. And so this gives us hope, and it gives us a plan, and it's not based on trust. Distrust and verify, so many of us have said that over and over again. So go ask them why not one of them could have the openness to support this. Yes, sir.
Madam Leader, are you troubled by reports the administration might be trying to influence the intelligence on ISIS?
No, I don't. I've not paid too much attention to that right now because we're involved in this. But I would be troubled by any interference in any intelligence. Yeah.
Are you concerned about the possibility of legal challenges?
No. Yeah. But why wouldn't we say the process has taken place, the agreement is going forward, and why would we put in doubt the determination of the United States of America to be a full partner in this agreement? It says the P5, United States, UK, United Kingdom, France, China, and Russia, +1, Germany. But when you read the agreement, it's the EU and all those member states, +3, the United States, China, and Russia. Why would we say we are going to abdicate our role in a cooperative effort to stop the proliferation of weapons of mass destruction? It's time for us to get serious. Okay, now have we finished on Iran?
I have a question about the Syrian refugees. Do you have any response to the announcement that the...
Okay, well, you know what? I promise this gentleman we'll come back to him. But you can't know how proud I am of the members because they not only are making a vote, they are making a statement about support for this, and they know how not only to defend their vote, but to advance this initiative. With that, I would probably reluctantly, because I carry it around with me all the time, and you know what? Like a baby, I would carry it. It's always growing more. Oh, Drew wants me to mention to you that as of now, we have at least 150 public statements of support for the agreement, which is quite remarkable because usually people would just say, people will know my vote when I vote. But it's the pride they take and the demonstration of their knowledge of the subject that makes this such a strong vote. On the CR, what was the specific question?
On the CR is, given the divisions that emerged with the Republican side, is it clear to you that Speaker May will have to provide you the Democrats?
What if my computer was in everyone's hands?
How are you to get rid of this sequester press that you called so big?
Well, I certainly hope so. But you'd have to ask the Speaker how he would bring his members together. What we keep hearing from the Republicans in the House is that they are not going to let anything go forward unless it defunds Planned Parenthood. This we're talking about keeping the government open and all that we are responsible to meet the needs of the American people. And what they are saying is for an ideological bent in their caucus, they would shut down government. That they are a luxury this country cannot afford. So hopefully, I'll wait to hear how the Speaker wants to go down this path, but I like your scenario. I hope that everyone heard it, that they're saying they're not going to vote for something empowers the Democrats, and therefore we'd have to be working together. Would that be the essence of what you said?
I'm wondering if you think that's going to happen.
Well, I hope it does.
One last question.
I know we have one more Syria. Going back to Iran, then we'll go to Syria.
I wanted to ask you if you could talk about how floor planning in for this debate. Clearly, the majority of the members are in support of the agreement. There are some members prominent in the caucus who aren't in support of the nuclear agreement. Can you talk about how decisions were made about who had time to speak on the floor and how everybody had a chance to sort of go on record?
Yeah, well, we originally had 10 hours, and that we were operating under that scenario. The question is about the very interesting to the American people subject of how we managed our floor time on the debate. No,
I'll take it.
Okay.
I'm still curious.
This is what is called inside baseball. Inside the baseball. The fact is, originally we were quite pleased when we heard we'd have 10 hours of debate. It would be distributed among the 5 committees. Then they changed it to 7 hours debate. So for those of you who are very interested, reducing it to 7 hours of debate means that we have 90 minutes, fewer minutes to make our presentation. That's either 91 minutes, 45 2 minutes, or 33 minutes. That's a lot of time taken away from members. That's a lot of members who wouldn't be able to speak, or all of them speaking in a much shorter time. But when they did it, they also took away the breakdown of the 5 committees of jurisdiction, and what we did there was to restore the jurisdiction of the 5 committees of jurisdiction, so that each committee, like for example right now, sanctions largely comes under the Ways and Means Committee, so they are controlling the time at the end here. You're welcome. It may not be a big deal to Northern, but it's a big deal to our members. It's the time.
President Obama yesterday directed the administration to accept 10,000 more Syrian refugees next fiscal year. Some of your members are calling for 100,000. What is your response to the administration's policy? Is that too few?
You know, I want to pay. I've just seen their number. I haven't sat down with them to see how that works. But I really do think that in the tradition of our country to welcome refugees from war-torn areas, that we should try to do as many as possible. I commend the efforts of Congresswoman Zoe Lofgren, who is saying, look, they're saying to increase the number of entries into our country by 100,000. They might not all be Syrian refugees, but a large chunk of them would be.
It was 200,000 total and 100,000 Syrian refugees.
Is that how she's framing it? Well, certainly there's a case to be made for that. It is interesting to note how the European countries, that Germany is taking the lead on this, and I read in the paper this morning that it could be a salvation to their economy to have this younger, newer population coming in to reinvigorate, I'm not just saying Germany, but the countries that are receiving them. Myself, my background, I wish that we could accept as many as possible. We took the lead after the the Vietnam War, where we were taking like 14,000 a month for a period of time from Southeast Asia. And when we did, other countries followed suit. So I don't know how the administration arrived at the 10,000, but that is going to be a strong focus for us. Our members expressed their appreciation to the German ambassador when he came to see us the other day about the Iran agreement, but commended him for the leadership role that Germany is playing. Well, in just a little while, we'll just see how big the margin is, and I thank you for your interest. Thank you.
All right, thank you all for watching this afternoon cast of News Now. I am Mike Paish, and Kinsey will be back at 6:30 with another stream of News Now. We thank you all for watching our coverage of, we had Donald Trump up there earlier. We were showing a little of Hillary Clinton campaigning, and then just hearing from Nancy Pelosi. So thank you all so much for joining us. We're going to have a lot more, including more on Donald Trump coming up at 6:30. Kinsey will be handling all that. She's getting ready for a great show. So if you haven't already done so, give me a follow on Twitter at Mike Paish, Fox10. Love to hear from you, and we will all see you at about 6:30. So you guys all have a good night, and we will see you shortly. Have a good one.